Good morning, everybody. And thank you for joining us for Mental Health Advocacy Day. My name is Lori Emerson, and I'm the Executive Director of the National Alliance on Mental Illness of Vermont. Mental Health Advocacy Day is an opportunity for us to, as advocates, to raise awareness about our lived experience, to inform and educate legislators about what's working and what we need to improve. Our theme is welcoming and caring communities, belonging for all. This is our 9th year in joining together as a united coalition with over 52 co-sponsoring organizations who have invited their network and community to be here today. And I thank all of you for your outreach efforts. And collectively, we have registered nearly 400 advocates, which does not include the watch parties for the event. So if you formed a watch party, let us know by telling us how many people are watching today. And please type your numbers in the chat. So we're very excited to welcome a great lineup of our agenda, beginning with a legislative panel discussion that will be moderated by the Department of Mental Health Commissioner, Emily Haas, and a second panel of community leaders that will be moderated by Robin Shabazz. The Unsung Hero Awards will be presented before lunch break and sharing stories in the afternoon. But during lunch, we will provide a slideshow with artwork and photos from previous mental health advocacy days during the week. We will be providing testimony to legislative committees for Mental Health Advocacy Day, with the majority of testimony being on January 31st. And so I want to thank all of you for attending today, with a special thank you to all the legislators who are here. And this event will be recorded and shared with everyone who's registered. You're able to access closed captioning, and we have ASL interpreters that can also be accessed on the toolbar. We're using a webinar format where we ask that you share comments and information in the chat. And if you have any questions for our community leader panel, type them in the Q&A. Please feel free to stay logged in for the entire event, even if you take a break for lunch. And if you find that you need support during the event, you can send a private chat to one of the co-hosts with your phone number, where someone will call you back. Or you can use any of the resources provided in the chat. At the end of the event, an evaluation link will be displayed on your screen, and we ask that you just take a minute to share your feedback with us. And now I'd like to turn it over to Martina Anderson.
Thank you so much, Lori. Good morning and welcome to our 9th annual Mental Health Advocacy Day. As mentioned, my name is Martina Anderson. I use she, they pronouns, and I'm the Communications Director at VMHAR, which is the Vermont Association for Mental Health and Addiction Recovery. It's my distinct pleasure to share today with all of you, passionate advocates and beautiful human beings who have tremendous impact in our communities. Today's thread that we are weaving throughout the morning is centered around the theme of belonging and how we together have the power to create welcoming and caring communities for all our neighbors. We all unite here with a common purpose: to raise our voices and uplift the cause of mental well-being. And as we gather, let us foster what we want to bring back to our communities: a deep sense of belonging, of compassionate understanding, and collective care. Let us break down the stigmas associated with being perfectly imperfect human beings. And let us continue to be curious and ask ourselves, what does it feel like to live in a world and in a community where we feel seen, accepted, nurtured, where we feel we are enough, and where we feel a deep sense of belonging? Together, in our collective dedication, we spread hope. We give voice to people still struggling in silence, and we can build a world where mental health is not just a conversation, but a priority. Each of you plays a crucial role in this movement, and your fierce commitment is the driving force behind positive change. I also want to take a moment to share my deep gratitude for all our wonderful co-sponsors. Without your support, this day would not be possible. Thank you so much for being a part of this movement. All right, welcome to Mental Health Advocacy Day. And now I'd like to turn it over to Amy Johnson.
Thank you so much, Martina. Beautiful words from Martina and Lori. I'm Amy Johnson, and I'm the Director of Government Affairs at Vermont Care Partners. And I'm really excited to be here today in such great community with all of you. I'm immensely grateful to everyone who is joining us to support such an important topic. We know there are many more people who walk alongside us in advocating for mental health. This topic is important to me very personally, as I know it is to many of you. Mental health conditions impact us all directly within our own ecosystems as well as peripherally. In promoting mental health and destigmatizing mental health disorders, we reduce barriers to care and help bring people out of isolation and create caring, welcoming communities. It is imperative that individuals can access the care they need in the way they choose, person-centered and person-led. Investing in a robust mental health system of care creates a healthier Vermont. Advocacy is essential in amplifying mental health. Advocacy can happen at many levels. We're here today, we're advocating. It can happen in the community through grassroots initiatives, legislatively, by connecting with advocacy organizations, through statewide efforts, and much more. It can take many forms: talking to a neighbor, educating a family member, disseminating information to those in your personal and professional circles, and sharing your own story. We all have a part to play in ensuring our communities are strong and welcoming. Soon, very soon, in a few minutes, you'll hear from wonderful community champions and legislative panel members on ways to advocate for mental health and what it means to have welcoming communities and ways to go about creating them. So thank you, everyone. And Lori, I believe we have a proclamation coming.
Yes, if Commissioner Hawes could join us. Thank you so much for being here. If you could unmute yourself, Emily.
I think I am unmuted. Can you hear me? Okay, good.
It's all yours.
Great. Thank you. So yes, we do have a proclamation today, and I'm excited to read that. Whereas approximately 1 in 5 individuals are living with a mental health condition in the United States. And whereas Vermont, like the rest of the nation, is addressing mental illness by combining effective prevention, treatment, and recovery support. And whereas the health, well-being, and quality of life of all Vermonters impacted by these chronic yet treatable health conditions, and many Vermonters know someone in their network or family or friends who is affected. And whereas Vermont's mental health organizations continue to educate the public and lawmakers about the effects of mental illness and the value of treatment and long-term recovery. And whereas Mental Health Advocacy Day is designed to remind all Vermonters that mental health conditions can respond to proper, timely interventions, treatment, and recovery support services, including the support from peers who have had successful recovery experiences. Now, therefore, I've never read a proclamation, but I assume I'm supposed to say Philip B. Scott, even though that is not me. So on behalf of Philip B. Scott, Governor, hereby proclaim the 29th day of January, 2024 as Mental Health Advocacy Day in Vermont.
Thank you, Commissioner Hawes. That was wonderful. Thank you for reading that on behalf of Governor Scott. I would love to invite all of the legislative panel members to please turn on your videos, and we will begin our panel once we do introductions. So once everyone's on, I'll introduce Commissioner Hawes. So I see Representative Rebecca, Representative Williams, And we have a few more.
The host needs to let me on, please.
Representative Stone.
This is Representative Carpenter. Okay, great. There it goes. Yeah.
And Representative Carpenter. Wonderful. We did it. So I'm going to introduce Commissioner Hawes. And before I do that, I just want to give a huge thanks to all of you for being a part of this panel and being a part of this day. We're really excited to hear from you, and we know that you are incredibly busy, spending a lot of time in the legislature. I see how hard you all work, so just really, really appreciative of you being here today. So I'll start with my introductions of Commissioner Hawes, and then Commissioner Hawes, I'll toss it over to you to introduce the rest of the panel. So thank you, Commissioner Hawes, for being here. Commissioner Hawes has worked for the Department of Mental Health in several capacities for more than 8 years. She was appointed to lead the Department of Mental Health in July of 2021, originally from Kansas. Commissioner Hawes spent 10 years working in community mental health with adults enrolled with community supports programs before relocating to Vermont. Prior to joining state government, Commissioner Hawes worked for Clara Martin Center in Randolph, overseeing their criminal justice and substance use programs. There's much more to say about Commissioner Hawes. I had to cut the bio down by a lot. She has done wonderful work on behalf of mental health. So thankful for you being here. And Commissioner Hawes, I will toss it over to you.
Great, thanks, Amy. I know we had a couple of versions of the intro, so I wasn't sure where I would have originated from today. So yes, Kansas is where it's at, or at least where it was 20 years ago. So it's my honor to represent our panel today. So I'd like to first start with Representative Daisy Berbecco. I don't know where she went. Oh, there she is. Oh, you took a different square on my Zoom. Representative Berbecco worked in mental health and substance use policy and advocacy nationally before coming to Vermont. She ran for office because she saw a need for more energetic policymakers and allies for mental wellness in the legislature. Representative Berbecco has introduced legislation to modernize and improve equity across our system of care. Thank you, Representative Berbecco. Welcome. Our next panel member is Representative Mary Catherine Abdelghani Stone. Mary Catherine is a Burlington representative who was elected to the Vermont House of Representatives in 2022. She serves as clerk of the House Committee on Education and has an occupational therapist at University of Vermont Medical Center when she isn't walking the halls of the legislature. She has worked on mental health policy and advocacy in her capacity as a lawmaker and as a healthcare practitioner. Welcome. Next, we have Representative Melanie Carpenter. Melanie Carpenter was appointed to the Vermont House of Representatives in March of 2023 and serves on the House Healthcare Committee. She is a farmer, former educator, and mother. Her work in her community, schools, and with families focuses on strengthening systems of support for mental health, wellness, and suicide prevention. Welcome. And last is Representative Jonathan Williams. Jonathan Williams is a state representative from Berry City. He has worked for more than half a decade for the Vermont Food Bank and has previously worked for various Vermont communities and has served in the U.S. Peace Corps. Welcome, Jonathan. Okay, well, let's get into having some fun this morning. Thank you to the panel. I've never moderated a panel, so this could go a few different ways, but my guess is we'll get to some good stuff. So real quick, for question one, how does a sense of belonging and community contribute to mental wellness? And we'll do this in a round robin format with around 2 minutes for answering. And I will start with Representative Berbecco.
Commissioner, I was wondering if I could add one thing to my bio. I was wondering if you would add it, and that's that you were my last boss before I joined the legislature.
This is true. Yeah.
So
Yes, Ed was on our policy team here at the Department of Mental Health before her successful run for the legislature.
so good things happen to people who work for you, and you are hiring right now. So hint, hint, folks. So belonging in community and their contribution to mental wellness. I feel like I can speak to this for myself. I'm a good authority on myself, and I feel like everybody has their own personal story of this contribution to mental wellness. I know I find so much of my mental wellness comes from finding community. I grew up in a small community, so I seek to build community wherever I go, whether it's in my workplace or in the community I live in my neighborhood, in my city. And obviously, that place means a lot to me. That's why I chose to run for office and represent my city and care for my community and fight for equity in my community, whether it comes to healthcare, whether it comes to their mental well-being, whether it comes to economic equity, social equity. But I think one thing that I would just hope to remind everybody today is that mental wellness and belonging and community is actually one of the primary social determinants of our health. And there's a ton of research actually out of the National Institutes of Health. So we have, a lot of clinical experts and academics that actually study this. So it's not just your own personal story that in your heart that validates the importance of finding belonging and finding community through your walks about your town and just how good it feels, after the pandemic to get out and, volunteering if you have time to do that, or finding a job, how good it feels to finally do that again and get in community. It helps you when you develop a sense of belonging and connection in your neighborhood, because those are actually fundamental pieces of your wellness. And that's actually a proven fact. So it's validating to actually look up that it's proven science, not just something that in your heart.
Thank you. Anyone else want to go next on the panel, or would you like for me to call on you?
I can speak if that's helpful.
Sure.
My name is Jonathan Williams. I represent Berry City. So with regards to how does a sense of belonging community contribute to mental wellness, I will speak of my own experience and speak to what happens when you feel a sense of loss in your community. As many of you know, a lot of central Vermont was impacted by severe flooding this summer and again in the winter. And to see your community and your neighbors lose their homes, to see physical spaces destroyed or completely transformed, I cannot say enough how much that impacts your mental health, one's mental health. And it's still going on today. And I find myself in the State House as a legislator lobbying for relief for my community and others. And there's a real tinge of emotion to everything that I do now. What was in many ways academic before now has real, I mean, everything we do has consequences, but it just really is hammered home how much what we do, how much we advocate for matters. And I'll just give a recent example. I was asked to read a devotional last week by the speaker because they didn't have anybody lined up. And I was
about this is my daughter who struggled greatly in high school with anxiety, depression during COVID. She went off to college 3 weeks ago, and it's been a little bit of a rocky transition. As people in my committee can attest, sometimes I get little SOS calls. But I got the text last week that made all the difference, and it's 4 words: I made a friend. And that changed the entire experience that she's having. So if we can do that kind of work in all of our communities and just continue to manifest that, I think that it speaks volumes for what we need. So thank you for including me, and I look forward to hearing more.
Thank you. There is a follow-up to that question. What makes it harder to have that sense of belonging and community? Any thoughts on that for the panel?
My initial thought, Commissioner, is that if we're not willing to be vulnerable ourselves, that makes it harder for others to, as Mary Catherine said, see that the table is already set, right? So I think we have to be vulnerable for others, let them know, hey, come on in, like you're welcome to. That's, just something that continues to resonate with me, is just vulnerability, especially around mental health. I think there's been a real dominant narrative that, mental well-being is, our focus has been on one end of the spectrum, and it's been on severe mental illness. And as someone that lives with, mental health challenges around anxiety and depression myself, I think there's a broad spectrum of individuals everywhere that live with mental health challenges. And so I think, as we're talking about connection and belonging and the challenges around that, I think it makes it harder for people to feel that when, people want to talk about everything that encompasses wellness, not just, the fact that they're hospitalized, right? So we need to make multiple points of entry for those conversations, not just the things about that imply that you're severely ill, right? So be vulnerable, be willing to ask someone, how are you doing? And make space to listen. I think that's the thing. Be vulnerable and take space and time for your neighbors.
Well said. I would say, just to comment on that real quick, it's always interesting to look at vulnerability and how that relates to being able to talk about mental health and wellness. Because it's assumed that all humans have an array of physical wellness. And so I love that we're talking about that all humans also have mental health and wellness too, and that we should be talking about both. That's the whole person. So I appreciate you saying that. Yeah. Any other? What makes it harder? Go ahead, Rep. Carpenter.
One thing that I've been thinking a lot, especially because I live and work in rural communities and I'm looking at our aging population, I think helping people have access and bringing down barriers by including more transportation, by bringing programs to people and really making those networks, because that's the piece I think, and especially in the communities that I serve, there are whole populations of people that can't even get to where our wonderful things are happening. So that's a place of work that I'm trying to do, is make those edges touch and advocate for looking where those barriers are and bringing them down, especially as we try to age well in Vermont. Thank you.
I can go.
Yeah, sure.
Okay. I say this with all due respect to this wonderful state that I live in and serve in, but in Vermont, sometimes I think it's easy for us to think about ourselves as a snow globe of exceptionalism, meaning that, oh yeah, of course, everyone already has a seat at the table. We don't, we're not Alabama, where I was born and raised. We're not, insert other place here. But the thing is, Daisy is right. We have to be vulnerable and realize that there are barriers in place to highlighting that seat that is already at the table. And it's our job to A, acknowledge it, and then two, do what Melanie said, tear down those barriers. So when we're talking about vulnerability, we also have to recognize that whether knowingly or not, we may be a part of a system that is intentionally making it to where folks don't feel comfortable sitting at the table. So that's that snow globe of exceptionalism, something to think on.
No, that's wonderful. I think that's very accurate. So thank you. Representative Williams, anything to add from your lens of what makes it harder?
I would echo what Mary Catherine and Daisy have spoken to, and barriers to access are real. Even logistical barriers to access, like Melanie said, being able to physically get to a location in a very predominantly rural state is a challenge. Are you well fed enough to be able to participate in a conversation is a question that we should be asking folks and of ourselves. So yeah, those are really big hurdles that we need to overcome and be conscious about overcoming them.
Well said, especially around food security and how important it is to have access to regular nutritious food. It's pretty tough to be vulnerable, have tough conversations if you don't know where your next meal is from, and it's been a while since you've had any nutrition. So thank you for bringing that up. Completely true.
Emily,
Yeah.
I think it's important to highlight just hearing everybody else's and the points that you've made on this, that I think this whole topic of the challenges for supporting connection and belonging in communities, it's really kind of getting at the upstream, almost preventative supports that we all need.
Mm-hmm.
And we talk about it when we talk about the continuum of care, right? Like we talk about getting upstream in my committee, in the House Healthcare Committee, and Melanie's on my committee as well. And for years, we've talked about investments into, inpatient mental health care, residential care for people who are mentally ill. And I think what I'm hearing in this conversation is people talking about more just organic community in the village, right? And there is legislation right now that all of us on this panel have sponsored or co-sponsored that is related to mental well-being and climate resilience. And I'd be happy to drop that into the chat so folks can read it. But what it does is it supports community-based services. So it often we're investing in, developing buildings and housing and things. But just as you said, food security and things like that are critical to basic needs and supporting people's wellness. And so I'll drop that in the chat and folks can see kind of where the rubber hits the road in terms of policy making and supporting these things that we're talking about.
Great, thank you. Okay, I'm going to move us over to question 2. Question 2, how can we best advocate for inclusive communities to strengthen mental wellness and belonging? So this time I'm going to have Representative Carpenter start us off.
One of the things I've been thinking about is just the power of storytelling. And I was really excited to see that later in your agenda. So I think having opportunities to continue to share our lived experiences and to listen to one another, to celebrate the joys and also to support when things are challenging or difficult, or helping people to find resources. One of the things that I really appreciated recently in our committee was we had a health advocate come in to speak to us about an issue, and they brought links to the StoryCorps that was on their website. And it was so powerful and moving to have that, and also such a resource for our state, because you can't always be in the room, but you could always listen to the story. Excuse me. So I'd like to see more ways of connecting that and using the technologies that we have to connect people.
Great, thank you. Anyone want to add on to that?
Don't be afraid to ask questions. Sometimes that's all it takes, is asking a hard question. I know for myself personally as a legislator, I'll tell a story that happened last week that everyone here on the call from the State House heard about. I serve on the House Committee on Education, and we had a big chunk of our day carved out to learn about what was going on with PCB remediation, polychlorinated biphenyls, the stuff that was found in the soil of Burlington High School, which has led to every school in Vermont needing to be tested. And the Commissioner of Health was on the call, and others were on the call, and they were just talking about all the data that they were taking about the potential effects of PCB exposure on respiratory health and on potentially causing cancer and all of these things. And I was just sitting there like, something's missing here. And so I raised my hand and I said, excuse me, is there any data being collected about how this impacts people's mental well-being? And I'm not just talking about kids in the schools, I'm talking about teachers, parents, the community writ large. And the answer was no. And I would like to think and hope that just by asking that question, that it's going to open up a bigger conversation and highlights, again, that seat at the table that's already there, mental health. That seat is there in every single committee that people sit on, and every single bill that we're looking at. But sometimes you just have to ask a question to highlight it. So yeah, start with asking questions, big or small.
Yes, absolutely. And knowing my friends at VDH, they probably heard that question and it resonated with them. So thank you for asking that. Representative Barbeco.
Melanie and I were in the same room when Vermont Legal Aid brought in some Medicaid expansion stories. They did sort of like a StoryCorps thing, and they have them on their website. And I have to say, that is really powerful. And another reason that it's powerful is it's organized and it's with a community. So NAMI does an incredible job of, structured advocacy. We have this day, and I know it'll continue on Wednesday, we have more advocates coming into our committee room to tell stories. And I think there's such power in that, because often policymakers can get caught up in sort of the forest, right? And I think having it brought down to personal level and individual level of the real practicalities and some of the day-to-day challenges that happen, and some of the success stories too. I think that's really important. We hear a lot from our neighbors and our constituents, but once in a while, it can be really motivational for us to hear a success story. And when people follow up and say, hey, remember a year ago, I couldn't get that surgery and you talked to Diva and helped me get it. That can be so immensely powerful, because we know that what we're doing is working. So stories, yeah, the good and the bad are really helpful. So thank you for sharing them, because it's not always easy. I know that.
Absolutely. Thank you. And Representative Williams, anything to add?
Yeah, I would echo the storytelling. Storytelling is demonstrably more effective at generating support for nonprofits in the state of Vermont. When I've seen organizations test that by sending out an email with a fundraising email, firstly with all of the facts and figures in the last year. We've done this, we've done this, we've done this, and then sending out a second email that is just a story about somebody who the nonprofit supported. And the second email, it's almost mathematical. Twice as many clicks, twice as many donations. Sharing stories matters. And I think too, applying a DEI lens to everything that we do, a lot of, folks do roll their eyes at that, but even in commerce and economic development, you'd think that wouldn't be that important. But let's use an example that's going on right now, the baby bonds. There's a bill proposed to that would basically generate savings for a person's born in Vermont that they would generate interest over time. And then when they turn 18, they could use that money for a set number of things like buying a home in Vermont or going to college in Vermont. But the question arose, there's a mandatory financial literacy component in that. And does that actually create a barrier? Is that exclusionary to some degree? What about folks who are English as a second language or migrants? To some people that seems like such an obvious thing that makes total sense. And then when you really look at it through that DEI lens, it raises a lot of questions about inclusivity and belonging. So.
Can I add one thing before we wrap this up?
Absolutely.
I agree that stories are super impactful and important, but something else that needs to be said is that we need to be creating safe environments and safe places for those voices to be heard and those stories to be told. We have to be really careful about tokenizing people, especially people who are more vulnerable with marginalized identities. So I know that the folks speaking on this call, we know that, but I just want to say that out loud, that it is also imperative that we create safe environments for those stories and those voices to be uplifted.
That's a really good point, especially around the token. Because there's also folks, the downside of storytelling also is the exploitation that can potentially come along with that. And so, as a state leader, that's certainly something that our department balances, is because we also, stories have so much power, but we also know that they can be used against folks.
Right.
and so, yeah, but I think that's part of what Advocacy Day assists with. Is supporting community members with advocacy and how to do that in a way to hopefully get to the place where we can have those storytelling and have that be in a safe environment where it doesn't have unintended consequences or the tokenism that you referred to. So that's a really excellent point. Let's see. I think I'm supposed to be moving over to a question and answer session. So I'm hoping that Amy Johnson has kept some sort of an eye.
I have. You have one question in the
Okay.
Q&A. You can either click on it or I could read it to the panelists, your choice.
Oh, Q&A at the bottom. Thank you.
Yeah, you're welcome. It's a long one.
Yeah,
But a
great.
great question.
Yeah, it's a great question. So I'm going to read it to folks. Should we say who it's from?
No, I think that's okay.
Okay, thank you. Okay, it says, I would like to hear from the legislators if there are any plans to increase funding for our mental health supports and services. I applaud the focus on increased affordable housing, but don't forget that we need more supportive housing for people with mental illness that require this assistance. There are waiting lists all over the state for additional supported housing provided by designated agencies. This keeps people ending up in expensive hospital settings where there is also a backlog in our EDs for these beds. People with mental illness deserve to receive care in their communities. That is an excellent question. Anybody want to take the first response? Okay, go ahead, Daisy.
And then you'll back me up, right, Emily?
I'll do my best.
You're coming in on Friday to talk about your budget proposal. So
this is very true. We are.
Yeah, we work very closely with the administration on all of trying to fill all of the needs across the continuum of care with the little bit of money that we have. it's really hard. And, you know, not just with the money we have, but, you know, we're always trying to pull down money from the feds as well. Like just Saturday, I forwarded a grant opportunity to the AOE for school-based mental health supports. So it's a complex equation to try and meet all of the needs of everyone in the state for mental health supports. We are just beginning our FY25 budgeting process, and Melanie and I will be working together with Emily, Commissioner Hawes, and the chair of our committee, Lori Houghton, to track all of the budget requests, whether they're coming in directly from the DAs. Sometimes they request to us things that they didn't get into the governor's request. And we make all our recommendations. So it's a pretty long process. We definitely like to make sure that if we're ever investing in the higher levels of care, that we're making equal recommendations in the lower levels of care. And that's where I like to focus. I know for a long time, there's been a focus on alleviating bottlenecks at the higher levels of care because there are always long wait times in the EDs. We get a weekly report from VAS on that. And so we are monitoring that constantly. They're weekly, not bi-weekly, right, Emily? Yeah, so we get those and they come to my whole committee. And so we're constantly looking at those numbers and agree that they're terrible. No one should ever wait that long. One, holding up hospital beds for people who need appropriate ED care, and people who need inpatient mental health care should not be waiting for that in a place that is not a therapeutic setting. We did last year in FY24 budget pass money for a new youth inpatient facility that will be in southern Vermont. Is that 9 beds, Emily? 9 or 12 beds? Somewhere in that.
9 to 12 beds. Sorry, I just ate a grape. But yes, 9 to 12 beds.
9 to 12 beds.
Yep.
And we know southern Vermont is not the ideal location. Those were the only people who applied to the RFP. So that's what it's going to be. And we will keep everyone posted as the budget process unfolds over the next month or two. Emily, is there anything you want to add, or Melanie?
I think a lot of what you said, I agree with a lot of what you said. And, you know, I think when I think about communities and belonging, we've started to shift in a good way from those conversations of, in order for folks to feel better, it equates being taken out of their communities and sent somewhere else. When what we really know is that our community members and we are all important and valuable to our communities. And so we started to shift that conversation that you don't always have to go to the highest levels of care to get better and feel better. We'll always need those. So we started to shift a lot of our policies back out into more upstream, like our mobile crisis response, the psychiatric urgent cares for folks who need those. In addition to, if you see somebody who looks like they might be having a hard time, or your friends, you could also just simply check in with them. And you're a piece of that community wellness when you do that. And I think that can be really tough for folks at times. So anyway, just acknowledging that, yes, we want to make sure people can get to the highest levels of care and have those available, but we also want folks to be able to get most of their services in their communities to not need those high levels.
Absolutely.
Yeah. Go ahead, Melanie, Representative Carpenter.
Yep. I just wanted to speak to the creativity that I see people using and the partnering that happens when we look at how to meet the needs at all the levels. And that I just want to highlight the fact that right now, with a lot of work with our state partners and our community partners, we're working on a credentialing and certification program for peer support providers and recovery support specialists. And that's an example of finding another way to draw down federal funding to support the work that's being done in our communities. And yes, we look at the bottleneck, but also looking at all the other pieces that need to be in place. And I just want to say how much I appreciate that creativity, and for Daisy for bringing that forward with other people. And that's the kind of work that gets me excited. I've never been through a budget. This is my first one. So I look forward to learning a lot in the upcoming weeks. Thank you.
Yes, go ahead. Representative Williams.
Thank you. Just one key issue around all of this is finding enough staffers to provide the supports that we're looking at. My Committee, Commerce and Economic Development, has been working nonstop on creating workforce pipelines for all kinds of fields, including the mental health professions. From what I've heard, there's figures in Central Vermont in communicating with various groups that for every one mental health professional looking for a job in Central Vermont, there are 6 to 9 open positions, and that's a real challenge. And related to that, we're talking about the housing challenges. Those individuals need houses, homes for their families and themselves as well as the persons who are being served. So, and then we need tradespersons to build those houses, and then the tradespersons need houses too. So it's quite a a mess that we're working on untangling. But it's a big one.
And I'll jump in. Yes, workforce is a huge part of this, and I'm really happy to have been a part of passing a lot of compact bills for folks who work in this in mental health, including an occupational therapy compact bill, which is in, I believe, appropriations right now. It passed through healthcare though. But I just wanted to tell a little story about something interesting that came through our committee last year, which was a workforce bill related to teachers. And there was a piece in there that ended up being like the biggest piece that we talked about and kind of debated, was for money set aside for affinity spaces for teachers who hold marginalized identities. And it ended up being like a really powerful debate because there was just a lot of like education and learning around what is an affinity space, why are they important, how would that help with workforce recruitment and retention, that happened around the table. And it successfully passed out of our committee with that language and with those dollars set aside for affinity spaces for teachers. So going back to the original question about belonging and community and how to create that, every little piece of policy we should be looking at through that lens of how can we create communion and community so that we enhance the feeling of belonging in our state to help with those workforce recruitment and retention issues.
Great, thank you. Okay, so I think we are about to wrap up. Let's see. So let's do a quick round robin for folks, 30 seconds or less. What advice would you give to individuals who are interested in advocating on behalf of causes that matter to them? This time we're going to start with Representative Williams because I don't think we've gotten to start with you first yet. So I'm going to let you lead us off and we'll go from there.
I love reverse alphabetical order when it comes to surnames.
Well, I wish I was smart enough to have done it that way.
I appreciate it so much. Coming into a committee room when speaking to legislators, know that if you don't know all of the acronyms and even if you're not an expert in the field, your voice matters, and especially a beginner's mind matters. It often reveals unique perspectives or raises questions that had not even been developed previously, and that is really, really important. So even if you don't know anything about a subject or just want to share your own voice in a respectful way, your voice matters, and your newness to the subject or to the space is also essential. Thank you.
Really well said. Thank you. Anybody else want to hop in? You know, it's a competition now. Oh, okay.
I was gonna let them go first.
I think I would say contact your local officials, your city councilors, because that's great to get started in your local community. There's always other people interested. If something excites you, find other people that you can organize with locally, and also contact your legislator.
That's great. Thank you. Go ahead, Rep. Carpenter.
I love getting invitations to leave the building and to be in community. Sometimes being in the State House, at least for me, I'll speak for myself, can feel a little bit overwhelming. So one of the places that I have found the deepest connection is going to people where they work, where they live, where they're feeling empowered. So I love those invitations, and we love food. So let's have lunch or a cup of coffee. It's great. Thank you.
Sure. Representative Stone, anything to add?
Yeah, have the courage to be vulnerable and speak truth to power. Show up, be seen, recognize that your voice matters, recognize that you matter, recognize that all feelings are okay, all of them, and it is okay to talk about them and share how you're feeling, because that's critical in order for us to have hard conversations, but also necessary conversations that contribute to the work that we all want to see being done. So show up, you matter.
Thank you. I also think another part of advocacy isn't always related to government. And so I think for folks who are working or who are interacting with their community or even their family. I certainly have to do quite a bit of advocacy with my family. For me, I started that on a small scale, like challenging and advocating for myself at a small scale, and then got more comfortable with that and grew that confidence into other audiences. And so I think that's also part of that advocacy development as well. So just putting that out there. We did have, I apologize, we did have a couple of questions that went answered, but I thought I saw them get answered in the chat. But I believe there was a question around Southern Vermont related to the adolescent inpatient perspective. So I think that got answered in the chat. However, the Department of Mental Health did put out an RFP for that. A piece of that RFP was that the respondent needed to be attached to a medical center. And that helps our goals diversify from the Brattleboro retreat, but also gives folks an opportunity who may have some complex medical conditions access to an inpatient unit here in Vermont. And so that is how it ended up in Bennington. There's a lot of services down in Bennington, so I think it's really a great choice. We also had some community members who wanted that to be in Chittenden County because it's the largest county. And so I would just speak a little bit to that. That did happen. And like Daisy said, we can't control who responds to RFPs or not. But I think from my perspective, we have a wonderful opportunity in the Bennington area. They also, with United Counseling Services, operate a psychiatric urgent care for kids. That is a wonderful collaboration between SVMC and UCS. And so we're excited to have all of those programs collaborating together to serve their communities. There also was a mention about peer certification, and there is legislation now moving towards peer certification. Vermont's I think the only state, or maybe one of 2 or 3, that doesn't have a peer certification. So this is a priority for us to get that across the finish line, and are taking a really thoughtful approach. So that is coming. And we're excited to move into that direction for folks.
Emily, House Healthcare Committee will be taking testimony on that this week. I think it's on Wednesday. And so that bill will be getting voted out of our committee within the next couple weeks. And we expect it'll pass over to the Senate uneventfully.
Great, thanks, Daisy.
Thank you. I want to thank Commissioner Hawes and the panelists for being part of this wonderful, enriching discussion. I got a lot out of it. I know there's a lot of conversation happening in the chat. I'm very appreciative of the work that you're doing and continue to do. I know that there were some questions that might not have gotten fully answered. We will follow up on those. So please know that. Our panelists need to depart, and we are going to be bringing in our second community panelist. So thank you so much. Giant virtual round of applause to everybody who participated in our first panel. And we will hopefully see you soon in the State House or otherwise. Thank you, everyone. And I would love for our community champion panelists to join. Hello, everyone. Thank you so much for being here. So I'm going to introduce our wonderful moderator, Robin, and then she'll take it away with our three panelists, Max, Kea, and Matt. So Robin Shabazz is an advanced professional in cultural intelligence, or CQ, a CQ skills assessment administrator, and a certified implicit bias trainer. Robin is also a certified facilitator in racial justice conversations. As a retired human resource executive with over 30 years experience in the field, she offers practical know-how to operationalize diversity, equity, inclusion, belonging, and cultural intelligence in an organization. She has delivered training and professional development resources for the Ohio Department of Health, Ohio Health, and Ohio Mental Health and Addiction Services. Ms. Shabazz has led other diversity, equity, and inclusion and accessibility initiatives with clients such as Summa Health, Hamilton County Developmental Disability Services, the Ohio Academy of Family Physicians, and Caracal Inc. I could go on much longer. Robin has a wonderful resume or portfolio of work. So Robin, thank you so much for being here and being our moderator, and thank you to the other panelists, and I will let Robin take it away.
Thank you so much, Amy, and good morning, everyone. I'm thrilled to be your moderator for this portion of the afternoon. And our session this afternoon will be on how does a sense of belonging support mental health and how can we strengthen it? And this is coming from the view of our community experts. We all know that belonging is a basic human need. We form ourselves into groups to which we belong our entire lives, whether it's our families, sports teams, spiritual or religious groups, political parties, neighborhoods, schools, departments, cities. We cannot separate the importance of a sense of belonging from our physical and mental health. And that's because the social ties that accompany a sense of belonging act as a protective factor, helping manage the stress and other behavioral issues like depression and anxiety that are very common in the mental health area that are associated with a lack of a sense of belonging. And today, our panelists are going to help us unpack what belonging in the mental health space looks like and how we can achieve it. So I'm going to take a moment to introduce each of our three panelists. First, we have Matt Wolf. Matt has worked with youth and young adults in Vermont for over 20 years, working to empower their leadership development while advocating with them in the Vermont system of care and legislature. Matt is a trainer of Youth Thrive, Youth Works methods, building flourishing communities, and various leadership development practices for youth and adults. He is active in training and promoting young adult leadership statewide and in supporting various agencies and their staff in developing an empowering system of care for Vermont's youth. Thank you, Matt, for being here today.
Thanks, Robin. Hey, everybody.
And we have Kaya Ganguly. Kaya is a grant writer and qualitative researcher with over 20 years of experience. She has successfully written private, state, and federal grants ranging from $2,500 to $2.5 million. She is currently the Director of Trauma Prevention and Resilience Development for the state of Vermont. She's an experienced teacher and trainer and has worked with all age groups. Kaya is a passionate advocate for resiliency, trauma responsive, and healing centered care, as well as diversity, equity, inclusion, and accessibility. Thank you so much, Kaya, for being here. And our third panelist is Max Barrows. Max is an outreach director of Green Mountain Self Advocates, GMSA. GMSA is a disabilities rights organization run for and by people with intellectual and developmental disabilities. Max is an autistic peer mentor who speaks up on behalf of people receiving disability services. He received a White House Champions of Change Award for this work in 2015 and a Champion of Equal Opportunity Award from the National Association of Councils on Developmental Disabilities in 2019. In his work, Max advances the message that when you meet an individual with a disability, presume competence. Thank you, Max, for being here this afternoon.
Thank you for having me.
Absolutely. Okay, so we're going to start off the question with the same question as we did with our legislative panel. And if you don't mind, Matt, we're going to start with you, and then Kaya will move to you, and then Max, you'll be our final panelist answering this question. What makes you feel welcomed and a sense of belonging? Matt?
Understanding. I feel like particularly on the subject of mental health, I feel like it's very similar. I saw lots of conversation about the peer support movement, lived experience movement in Vermont, and that when folks understand and appreciate where you've been and really listen to understand, not to respond, that's what's helpful to me.
Thank you, Matt. Okay, Kaya.
So I'm going to agree with Matt, first of all. I usually do. But there's also a depth for me. I am a first-generation immigrant and a person of color living in the state of Vermont, which is very white. So when people actually acknowledge that I am different in some way, that helps. When people ask questions rather than assuming, that helps. Belonging is such an interesting construct psychologically, because it really, as you said, feeds into mental health challenges such as depression, anxiety, but it also to uplift us and be protective. So yeah, I think it's almost at the basis of a lot of issues that we are facing today, from mental health parity to DEI.
Absolutely. Thank you so much for that. And Max, your perspective on what makes you feel welcomed and a sense of belonging.
Well, I belong to a self-advocacy group for people with developmental disabilities, and I feel welcome and have a sense of belonging by connecting with others who have similar challenges. Peer-to-peer connections support us to further accept who we are. You absolutely get the honest truth from your peers. You are hearing it through the experience of peers directly. When there is information coming from others without disabilities, it can be sugar-coated. The environment can feel too controlling and biased. When you connect with peers, the atmosphere can feel safe. We need safe places to discuss and deal with ableism and racism. When I am with peers with developmental disabilities, I feel that I am with family. And this is why we are asking you to prioritize self-advocacy.
Thank you, Max. And Max, you touched upon what's leading into part B of my question on what makes you feel welcomed and a sense of belonging. It's that other side of the coin. What makes it harder? So, Kea, what makes that harder?
So, and it's interesting, at least for me, because I can only speak from my experience. One of the things that makes it really hard are reactions that people think are being supportive. Things like if I talk about an incident that may have happened, oh, I can't believe that happened to you. Oh, so I'm lying? Because that's the underlying message that I get. Or I am so sorry. Well, you didn't cause me harm. I'm reciting something. So apologizing for something you haven't done makes me feel very othered. And that's the opposite side of belonging. It's othering and making us feel like we are not a part and doing it in such a way that you almost feel called out. So I would say that more than anything makes it really challenging.
Thank you for sharing that perspective. And I feel like that is probably some new information for a lot of people who are probably listening in. So that was really very honest, open, and transparent. So thank you so much, Kea, for that. Matt, your perspective on what makes that sense of belonging difficult to achieve?
Well, I mean, it's very similar to what Kea was saying. Even well-meaning people, I'm not even going to talk about the people that don't mean well, but even well-meaning people can approach a situation that you're talking about and think that they're helping in a way like, oh, I can't believe that person did that to you. I want to, X, Y, or Z. And I think it ties into what Max was saying earlier about being seen or feeling seen was part of what I heard from Max, and that if something negative has happened to you or something has happened that made you feel a lack of belonging, someone that cares about you may say, oh, well, we should, get rid of that person or remove that person. And instead, what would help me feel seen is the acknowledgement of, my feelings, or that this person has shared that kind of experience, or, keeping the focus on me. So I think a lot of times, like I said, well-meaning people try try to do well, and it doesn't always work.
Absolutely. We know that it's we often hear, about intentions, but it's impact, right? It's not, it's not your good intentions, it's the impact. So thank you again for clarifying all of that. We're going to move into our second question. And I'm going to start with you, Max, and then I'm going to move to Matt, and then Kea, you'll bring up the rear, so to speak. Let's talk about why belonging is an essential element in mental health. And while we're thinking about that, I just want to share with you, and I know this audience is probably very familiar with it. And it was just always something that really struck me in doing research on this topic. And as a DEI professional, belonging, as Kea mentioned, is connected very much in the DEI space. However, the studies that are out there that have shown how that the brain, the same region of the brain where we have the craving for food, is the same region where we have this craving for connection. And the region of the brain where we experience physical pain is the same region of the brain where we experience this social exclusion, was remarkable for me. So that for me, that is such a powerful way to think about how important belonging is in this mental health space. So when you think about the importance of belonging as an essential element in mental health, Max, what comes to mind for you in your experience?
What comes to mind is we need our support staff to help us make new connections at work, community centers and places of worship with our neighbors. And over time, these connections enrich our lives in many ways, keep us safe when staff are not available. You can help us discover ways to find people in our community who share our interests and talents. Some of us need encouragement and, support to introduce ourselves to new people and, get involved in new groups. Having natural support, which comes from relationships outside of work, such as like friends and or family, increases a sense of belonging and lessens feelings of isolation and loneliness, which is especially important in the lives of people with developmental disabilities and other marginalized individuals. For example, like my father supported me at times for work when I didn't have support staff or a job coach. And I'm wondering if it's okay if I could just answer the question earlier of like what makes it harder.
Yes, please.
So I'll be quick with this. So going back to the whole belonging, what makes it harder? And that is like, unfortunately, people with developmental disabilities are often looked down on more than looked up to. And society continues to send a strong message that we are not capable and we are too slow. And it ties into the false idea that we as people with developmental disabilities are not able to do a lot of the things for ourselves like adults without disabilities. And unfortunately, it is a pretty broadly accepted mindset. It casts a shadow over our desires to work, go to college, date, travel, get married, raise a family, and much more. And because it is hard to know what to do, a lot of people within the disability service world are reluctant to talk or think about ableism. But we can't ignore this problem. Everyone has to help end ableism. And no one can fix everything all at once, but there is always a way to help.
Thank you for that, Max. And it starts with dialogue, talking about it. We often shy away from those difficult, uncomfortable discussions. However, that's where change starts with having these types of discussions. So thank you for that. Kea,
So,
belonging an essential element.
so I would say, one, as you already mentioned, it's buried in our biology. The function, and if you look at our brain, which I always say is a weird and wonderful thing, and that what we require just as human animals is that sense of belonging, and there are actual biological pieces behind it. And there's a lot of research that will show, especially on animal research on mice and things, that show people will act these, I always call them people, but these animals will actually retreat and can die from lacking connection. It's a very dynamic and emerging construct. So there's still lots of work being done in this area. But the other thing to really think about when we're talking about it being an essential element in mental health is, how do we define mental health? And how do we enfold pieces of identity and culture and accessibility? All these pieces fit into making us individuals. But our society, which is built on systemic racism, is created to uplift one specific type of individual. It's created to make life easier for one specific type of individual. And I'm not judging anyone, because I'm not saying that people chose this. It's just the way things are built to make things easier for people who are white and male. Well, for people like me, who happen to be brown and female, I don't fit that mold. So I don't quite belong all the time. So the more we start thinking about it and thinking about how these pieces can be enfolded, and the more sense of belonging that we can create, the better mental health people are going to have. I mean, one of the statements made, and I think Max could probably really speak to it, is people with developmental disabilities or people with a mental health issue often say, I feel so alone. There's no one else like me, because society hasn't been created to make it easy for people like me or other people who are divergent in some way.
Absolutely. Thank you. Thank you very much, Kaya. And Matt, if you have about 2 minutes to give us your closing thoughts on why belonging is such a essential element in the space of mental health. Why we have a whole panel discussion on this. Why is this so critical?
Well, I just think really quickly when I've been spinning out, when I've been at my worst, I think about it is about an increased stress level. So when I talk about spinning out, like there's so much going on. I think another thing that really exacerbates when I've had a hard time is some sort of a shame or some sort of not feeling good about that piece of me. And so that sense of belonging is essential because not only does it help to normalize like that, whatever I called it, shame, I guess, but whatever I'm trying to hide and pretend isn't there, and also brings down that stress level and stops the spinning and the chaos. And it feels like there is some understanding and some support that you're not the only one, that you're not alone, that there are a variety of different ways that, people have been there and understand. And I heard recently someone say that, if you look at it truly, we as humans, all of us, have more in common than we do have differences. And if we really focused on those things that we have in common, a variety of things, like Max is not just someone with a disability. Max has a variety of other identities and interests in ways he could come together with people, just like I do and just like Kaya does.
Yeah, I agree, if you don't mind me jumping in. But the one piece that gets overlooked when we do that might be the most important piece of someone's identity. So yes, we need to pull on how we do have commonalities, but I think we need to figure out a way to celebrate differences so that they don't get addressed as something that's lacking within that person, but something that enriches us as humans and as a community.
Absolutely. Yes. Thank you for that. Because it's not either or, it's both and, because that's why belonging is an elevated experience than just being part of a social group or just a social connection, where you may have some things that are in common, but those differences being seen, accepted, and supported with those differences is where that sense of belonging comes into play, and being able to share those differences, talk about those differences, wear those differences proudly, is what creates that sense of belonging. So thank you. Good dialogue there. So as we think about, now we're going to think about ways in which we can actually create a sense of belonging. So I'd like to just kind of go around and we'll do a round robin. And I would like for each of the panelists, and we'll start with you, Kaya, what are 2 small ways we can create a sense of belonging within the workspace and within our communities where we live, work, play, operate? What are 2 small ways we can create a sense of belonging for each other? Kaya? And then we'll go to Max, and then Matt, you'll wrap that question up.
So it's interesting because I was looking at the questions in the Q&A, and one of them feeds into this. It's something I'd said earlier. The question that's actually addressed to me is, what is a suitable alternative to the phrase, I'm so sorry? So I always love it when people ask me, and how do you feel? Is there something I can do? I really push saying that we as a society need to be trauma responsive and healing centered. If you are responding to trauma, you're actively doing something. So that's what you can do in work, is be willing to be the person who maybe witnesses a microaggression or something and stands up, so the person who's receiving that microaggression doesn't have to do all the work of saying, hey, you may want to think about how that's phrased. So one is being the ally.
Mhm.
is one piece of it. And two is being willing to ask questions instead of being embarrassed or making assumptions. You did this today, Robin. For example, the number of times my name gets mispronounced because people don't bother to just ask me. You know, I would rather you just say, hey, I'm not sure how to pronounce your name than butchering it. So those are two examples I've got.
Well, thank you for that.
Mhm.
So yes, we often allow, and I'm going to say this word, ego, to get in the way of just asking, saying, I don't know, and how do you? And I'd like to know more. And it's okay to ask those questions that we often think make us look silly. They actually don't. They are helpful, and they convey a true sense of I am interested in you, and your identity is important to me. So, and of course, name pronunciation is important to our identity. So thank you for that. Max, what two small things that we can do to create a sense of belonging for each other?
I will say, don't assume what someone with a developmental disability can or cannot do based on what you see at first. You know, presuming that a person is not intelligent based on how they look or move is a tragedy. Don't assume that we can't do things on our own. We may need, support, but give us opportunities. Believe that all people with developmental disabilities have abilities. Have high expectations and dreams for us. You know, most people with disabilities perform better than expected when others expect us to do well. Support people to make peer connections. You know, in my self-advocacy group, we welcome new people. Relationships are where change happens, and we need to understand where somebody is coming from. That gets us closer to change. And basically, our message as people with developmental disabilities is we want what you got. This means a safe place to live, jobs, education, friends, intimate relationships, respect, and being loved.
Thank you. Thank you, Max. I love that. Relationships are where change happens. Um, Beautifully said. And Matt, what are two small ways we can create a sense of belonging from your stripe on the beach ball?
I mean, it's supportive of what both my co-panelists have been saying and I've said it before, the idea of listening to understand, not to respond, that involves being curious, right? Like asking about, how did that make you feel, like Kaya said, or what would, what do you need right now, or what would be helpful? And I guess the second thing is to navigate your world in terms of the ego thing you were talking about, Robin. Navigate your world as a learner. If you're learning from the world around you, that means that you don't have to get it right. So you're allowed to ask Kaya how to pronounce her name, or you're allowed to make a mistake and maybe say, hey, that wasn't the way I intended that to come out. Let me try again, because it's all a learning process.
I love that one. Navigate your world I'm going to put a constant learner. I love that one too, Matt, because that's the truth. We all are. I mean, culture is dynamic, and we live in a dynamic world, and nothing else. And so we're constantly evolving. So we're going to transition now to Q&A. So I know I've seen the chat is bubbling here, which is awesome. And we have a Q&A portion of the panel discussion. So we're going to pop over here, and I'm going to take a look at these questions here. And if there are any questions over in the chat that we want to move over into the Q&A, we can do that. So I think one we've already answered about the suitable alternative to the phrase, I'm sorry. And if I recall, KS, one of the ways was just to ask, what can I do to support you? How can I support you? If you want to expand on that, that's fine to do.
Well, there's this assumption that an apology makes things better, always. And I think that's one reason we default to it, is it's a way we think we're showing empathy.
Mhm.
But if you think about what Matt said, it actually acts almost as a roadblock, because you sit there and you start thinking, okay, so they've apologized. I say thank you and we move on. That's what we're trained to do, versus rest in a place that is not comfortable. Because sometimes we learn more through discomfort than we do through being accepted, as much as odd as that sounds. But if we really want to grow, and that's something I passionately believe in, is that everyone can grow no matter age, circumstance, anything. We have to be willing to take the discomfort that comes with growth.
Mhm.
So really being able to listen with empathy and be present is so valuable, because the few times it's happened for me when people have actually just either interceded for me or who are willing to sit in that space for me, I can still to this day actually identify them because they were that profound for me.
Oh, I love that. The discomfort with growth. That's powerful, because if you think about it, they don't call it growing pains for nothing, right?
Yep.
Right. So it's all about, stretching. And when we're stretching, it's a little bit painful. So all of those metaphors, they all make sense. So thank you. Thank you for that. We do have a question in the chat, and I'm going to um, pose it to all three of the panelists. And if anyone wants to answer it in the chat, that's fine. And then we can have some panelists answer it verbally. How do you deal with someone saying, well, you look normal?
Can answer that.
Okay, yes. Max, you want to start off, and then Matt, if you and Kaya want to chime in, that's perfectly fine.
So the problem with normal is society has this expectation where if you're normal, you have to be and look a certain way. And what I say to that is this: normal is, if whatever you define as normal or what makes you who you are, that's what it is. But in the disability, the self-advocacy movement, we just say normal is just a setting on your washer or dryer, but there's no have to be a certain way to be normal. And the problem with normal is, just people want to normalize us to where we're not something that is seen as less, like, or else we're just seen as less than. For me personally, everything that makes me who I am is normal. Having a disability, having a mental health condition is normal. It's the normal part of being human. We see disability as just another way of how the body moves, how the body works. I see mental health conditions as just another way of how the brain works. Do we need support for that? Absolutely. But that doesn't make you any less than somebody else because you don't fit just because, first of all, society just has this expectation where it's like, if you don't fit the expectation of what normal is, you're not normal. So when someone says you look normal, it's like, well, what exactly do you mean by that? But then if I were to internally embrace it, I would say, well, maybe if you're referring to, and I'm hoping you're referring to, whatever makes me me. And just if you're saying if you're saying that, I'm just myself and that's what you like, then that's better than just assuming that, oh, because I don't look a certain way, it makes me normal, or I don't act a certain way, it makes me normal. Then what does that mean exactly from their point of view?
Thank you for that. Well put.
And I'm going to just build on that, because there's this whole other piece that we really haven't touched on a lot. But when you have an identity that does not fit the norm, whether it's being a member of the LGBTQIA plus community, being neurodivergent, being a person of color. Really, when you start adding us all up, we outnumber normal. And maybe it's about time we really start acknowledging that, like Max is saying, that this is normal. These are all normal. And maybe we need to either widen the definition of what normal is or actually find a different word. I often say when I'm doing presentations, I hate the word normal. Because it's just implying that there's a standard that we are failing to meet. And that things that are beautiful also fall out of the norm. So are we ignoring beauty and growth as well as challenges?
Thank you. Thank you, Kaya. I mean, normal assumes that there is some standard that you're being compared against, right? So then it goes back to who sets the standard, right? So, Matt, did you have any final thoughts on that?
Basically that, Robin, that normal implies that there's some sort of one way to get it right. And honestly, if we were all the same, life would be really boring. Like, you know, I mean, back to what Kay has been saying about celebrating diversity, celebrating differences. It's like, that's what, you know, makes life exciting and interesting. I don't even need to say more than that. You already said it. Thank you.
So wonderful. Okay, well, we have another question here. And so the question is, this participant is relatively new to NAMI, so we're going to give them grace. And they are asking what efforts are being made to increase peer support. The person says, I feel that this area has limited support in many different areas, including case management, housing, therapy, etc. Any thoughts?
I can speak to I actually based out of the Department of Mental Health. I am not in the depth of this, but what I can speak to, and I think Max and Matt will have a lot more to say, is that in this session, as they said earlier, we are finally taking up a peer support certification bill, which makes it's important because, you know, do I believe that that certification is going to make someone magically better at providing peer support than they were before? No. You know, if you're working from lived experience, you know what your lived experience is, but it does give us a way to start making it easier, I guess, for lack of a better term, for insurance reimbursement or changes in functioning. Or if you look at some of the things that have been happening, peer support is becoming active. If you look at the 988, part of that 24/7 response, there are in some counties right now, I believe, peer support specialists who have been hired and are going out on those crisis calls. Some of our designated agencies already use peers for support. I only see it growing now that we've started looking at it, but I think that certification is a huge important step.
Good. So peer support is moving. So as we begin to wrap up, I'd like sort of like this lightning round here as we start to think about, as we wrap up, we may have time for, if we have one more question. And let's see, what caused the state to pursue this certification all of a sudden? And I'm not sure if we know the answer specifically to that question.
I don't think it's all of the sudden. I think it's due to a lot of work that has been put in by people like Matt and Max and others who are in this call and out of this call. I think it's just finally sort of come to a head to the point where, you know, sometimes it takes time for things to rise. Yeah, I see. It's been since 2006 that we've been trying.
Yes.
So I put credit at this totally in the peer community for pushing and saying this is important. You know, yes, there were a lot of other people supporting it, but my hat is off. It's such a beautiful example of grassroots activism. which
Well,
is how change occurs.
Yes, outstanding. And since
Matt looks like he wants to say
oh,
something.
I just wanted to say briefly, part of the reason it's a complicated issue is that the certification of peer supports implies oversight by the mental health community, which by definition is sort of contrary to decades worth of grassroots peer support that we have going on in Vermont. So when folks hear Vermont's one of the only states that doesn't have a certification, it's not because we haven't been working on it. It's because, in my experience, we've wanted to keep it true to the movement.
Mhm.
okay.
Exactly. So it's just
Right.
all of this stuff is complicated.
Okay. All right. We have about 1 minute. Max, you got about 1 minute, and then we got the wrap up. Okay.
Yeah, so I wanted to just address something in the chat that they tried to put into the Q&A, but they couldn't. But they want it said. It's from two individuals who I know, Martina Anderson and Chris Medina. And so they said, okay, from Martina, she said, my son lost all of his services, both his 30-hour per week trained employment community support staff and his case manager back in March of 2020. Since
Max,
then, he has,
I'm so sorry to interrupt you, but I just tried to have it be posted. Again, it's not my son. I just wanted to uplift
oh, I'm sorry.
Chris. So I think this is all
I
Chris and their partner.
oh, can I still read it or should I read his?
It's the same one. I just copied and pasted it.
So
Oh,
I
you
think
did? I'm
Max,
so
you can
sorry.
just read it, and I think we can just move on to the last question, and then
Yeah.
yeah.
Yeah, they couldn't find the, sorry. Anyway, so it says, my son lost all of his services, both in 30 days per week, trained employment and community support staff and his case manager back in March of 2020. Since then, he has had limited, if any, support from WCMH. I have already retried from my full-time 40-hour 40 per year teaching position, but was still working part-time. My son requires 24/7 care, so I had to quit my job at the present time, with the exception of 5 hours per week, bowling, swimming, walking. He remains isolated from his job time with his peers and other meaningful time within his community. I have reached out many times over the last few years for help within his agency staff with Dale and Vermont Legal Aid. He finally has a new case manager that is trying her best to improve his services. When Chris was asked at his recent meeting with his case manager, what he said brought tears to both of our eyes. He uses facilitated communication and typed, I feel like I really don't matter. Followed up with this. It just says, wrote in chat about Chris's lack of services and supports and helps everyone understand how difficult this has been for Chris's mental health and his sense of isolation.
Okay, thank you for reading that, Max. I think that was a panelist, or excuse me, one of the participants that shared that earlier today in the first part of the legislators panel review. And so it was just reposted for our information. And we're going to, as we wrap up, we're almost out of time. We literally have 1 minute left. So you have 15 seconds. If you were to leave one message with everyone here, what would that one message be for the audience to walk away with on this topic? So we will start with you, Kea, then we'll go to you, Matt, and then Max, that 15-second message will end with you. So Kea?
I will talk with the opposite of belonging, which is othering. Understand that othering is a way to dehumanize people. So trying to focus on everyone has commonalities as well as differences, and both should be celebrated.
Thank you for that. Matt?
Yeah, celebrate just the diversity and excitement of whatever individual is in front of you. They have a wealth of knowledge from their own experience.
Celebrate. Thank you. And Max,
I would say avoid using stereotypes in your thinking, have an open mind, and presume competence in yourself as my peer, my support worker, my ally. Sometimes you might be stuck and don't know what to do next. Stick with it, be a little creative, and believe you can do this. And again, normal is just a setting on the washer and dryer. Other than that, there's no right way of being normal.
thank you, everyone. And especially thank you to Amy and Lori for having us all. Thank you. Thank you, Kaya, Matt, and Max.
Thank you so much, Robin, and our panelists, Max, Matt, and Kaya. Really appreciate your sentiments, very powerful sentiments on the intersection of mental health and ableism, our need for connection as an essential basic need. Relationships are where change happens. And this really dovetails nicely with our first panel and what panelists said, specifically Representative Stone on people are whole just as they come, and helping them to get into that seat at the table. So thank you to all of you. This has been wonderful and just very powerful to listen to. So thank you to all of our panelists. We are now moving in to the awards section of our day. So I'm going to pass things over to Martina Anderson.
Thank you so much, Amy. It's such an honor and a pleasure to take the next few minutes to guide us through the 2024 Unsung Heroes Award ceremony. We have 5 beautiful humans who we want to honor and uplift for their incredible work and their huge impact in our communities. And I'd love to ask all of the award recipients if they are comfortable to turn on their video now so we can celebrate you all. And we have Kara Greenblatt, Mike Riley, Sam Weber, and Tanya Hayes. If you're here with us, we would love to see you. Hi. So I'm actually gonna kind of start with what Kaya was mentioning earlier, because I have been thinking to myself, is it Kara or is it Kara? And as someone who has their own name mispronounced often, I wanted to ask you first, most important question, how do I pronounce your name correctly? Which might still be hard because I do have an accent. Oh, I think you're muted. All right, I think now you might be unmuted.
Can you hear me now?
Yes.
It's Kara. Thank you.
Kara. Okay, great. Amazing. And then Tanya, I see that you are also here, and I think Sam has joined in a watch party. Amazing. Awesome. All right. First, I do want to start with you, Kara, in recognizing your amazingness. So Kara Greenblatt was nominated by the Howard Center, and the Howard Center, I think you joined about 5 years ago as a member artist, and you have been very instrumental in running the group and also growing the group tremendously. And the Howard Center Director of Client Services, Beth Holden, remarked, Kara is a shining light at the Howard Center who initiated and continues to grow our arts collective. Her passion is contagious, and she beautifully highlights the talents of those receiving services while creating an inclusive environment, increasing a sense of belonging, and reducing stigma. Kara, it's my absolute pleasure to award you with the 2024 Unsung Heroes Award. And I would love to ask you if you wanted to share a few words with all of us.
I would love to. Can you hear me right now?
Yes.
Can you hear me?
Yes.
Okay. Yeah, first I just want to say my first brush with NAMI was taking the family to family course many, many years ago, and it was absolutely life-saving to me. So thank you to NAMI Vermont for all that you do. I want to thank Mike Glott and Denise Figno for nominating me into the Howard Center leadership for their ongoing support to our artists, to the Arts Collective. I also want to thank my mom and dad for always modeling the importance of giving and providing leadership in service to those of less fortunate in their own community. And then I just want to say a little about the Arts Collective. The Arts Collective is a community of artists impacted by mental illness and addiction. We use the term artist to encompass all levels of creativity from beginner to professional. And while making and sharing art is absolutely an important piece of what we do, I would say that even more valuable is the sense of community that we've created for our artists and with our artists. I've asked one of our artists if I could read this email that she sent me about 6 months ago. And in it, she says, I used to wake up in the morning and think about what it might be like if I didn't exist, if I didn't feel constant sadness and have so many bad thoughts and memories. Lately, though, I wake up thinking about what I'll be painting in the studio tomorrow, and I look forward to seeing my new friends on the Thursday community Zoom call. Being alone with my illness is less hard when I know that I have all of you in my life. So that really touched me. And I'll just say that creating a culture of giving and supporting and encouraging one another through difficult and happy times is what we do in the Arts Collective. We're a social safety net. We reduce stigma and discrimination, and we support wellness. But most importantly, we love and care for one another deeply. And I feel just incredibly honored and privileged to provide leadership and facilitation to this group of talented, thoughtful, and caring individuals. So thank you, NAMI, for this award.
Thank you so much, Kara. I also dropped a link into the chat for anyone who's interested. It was so great to read a little bit further about the Arts Collective and see, what you all are up to. And yeah,
Thank you.
Thank you so much for being here today and for all that you do. Next, we have Mike Riley, who is the development coordinator at Champlain Community Services and a talented photographer at Mike Riley Photography. He has worked at CCS for at least 18 years, and he was also a former journalist, softball and volleyball coach, and the executive director of a community justice center. Beth Seidler, the executive director at CCS, says the following about Mike. He's a vocal advocate for mental health. Mike encourages open dialogue about our mental well-being. He advocates for seeking help when needed and offering care and support to others in their struggles. Mike promotes a culture where taking mental health days and expressing genuine feelings during check-ins are not only accepted, but encouraged. His efforts challenge the stigma surrounding mental health issues, emphasizing the strength individuals exhibit as they navigate these often silent struggles. Mike, I also hear you really like to cite a specific quote from James Baldwin, one that I personally love very much. And I wanted to ask you if it was okay for me to share it, or if you yourself wanted to share it with all of us, not to throw you under the bus. Do you want me to read it out?
Yes, you go ahead.
Okay, wonderful. If one really wishes to know how justice is administered in a country, one does not question the policemen, the lawyers, the judges, or the protected members of the middle class. One goes to the unprotected, those precisely who need the law's protection most, and listens to their testimony. Mike, I am thrilled to have you be awarded with the 2024 Unsung Heroes Award. It is so well deserved, and I'm curious if you would like to say a few words.
Well, I will. I'm not sure if I'd like to, but I'm so overwhelmed in a way. And Kara was so great with her extemporaneous talk that I like to do that myself, but I actually jotted a few things down because I wanted to include a couple of things I heard this morning. And also, I'm just so overwhelmed that I'm afraid I'll forget if I don't read. So I apologize for reading something. But I'm so honored and humbled to be recognized at such an important event among such dedicated and hardworking people. And I do want to thank Beth and my nominators at CCS. I'm truly touched. Mental health and mental illness have been a thread woven deeply into the fabric of my life Yes, my work life, but also my family life, and for me personally. This morning, Representative Burbico advised that we be vulnerable and make space for your neighbors. And I think that's been my guiding principle in my approach. I'm not sure that's made me award worthy, but I'm proud to know it may have helped others at times when they felt alone. In my own life, I've been lucky to have had friends and colleagues who have been advocates for mental health and been supportive of me when I've faced personal crises. I'm here today in large part because they helped me face my challenges with a focus on opportunities for health and self-care rather than for harsh self-judgment. They protected my dignity and made it clear I need not suffer alone. If I've earned this recognition, I will accept it in honor of those amazing people. They were my inspiration to try and my teachers of the fact that we can make a difference for others. And they encouraged me, as Representative Stone said, to show up. We all matter. We do, and we can all make a difference for each other. Belonging and community were key topics throughout this morning, and those are core values of mine. I pledge to keep them at my core moving forward, and I encourage people to remember to just come as you are. Thanks so much.
So beautifully said. Thank you so much, Mike. So well
You're
deserved.
welcome.
Our third award today goes to Sam Weber. Maybe we need to have you stand up so we know where in the room you are. Sam works at the St. Albans Police Department as the embedded crisis worker, and national data suggests that a person having a mental health crisis in the US is more likely to be incarcerated than getting the medical support or treatment they deserve, making jails the largest behavioral health facilities in the country, which they're clearly not equipped for. At a moment of national reckoning, we are excited to see Vermont looking for different solutions, and Sam is one prime example. Sam is an advocate who gives people from marginalized communities a voice who would normally only be served by police. She gives people hope, a sense of belonging and community, and works towards reducing social isolation and stigma. Her passion for advocating on behalf of those experiencing trauma, substance use, a mental health condition, or intellectual and/or developmental disabilities successfully impacts access to quality services, informs public policy, and improves public awareness and education. Sam, it's my distinct honor to present you with the Unsung Heroes Award of 2024. And would you like to share a few words with us as well?
Yes, ma'am. I'm sorry. I didn't have anything prepared, but I'm certainly honored to be nominated. And I just think that it all speaks to the importance of these embedded clinicians within law enforcement across the state. So we really get to do something unique here.
You're wonderful. The last but not least you'll hear from me is awarding, I'm so sorry, Tanya Hayes, I think Tanya, yay, hi, so good to see you. Tanya Hayes is the co-director of student services for the Missisquoi Valley School District, and she was nominated by Christopher Dodge, principal at the Swanton School, who shared this about Tanya. Mrs. Hayes is a tenacious advocate for promoting the least restrictive environment for all students, including those that may be experiencing mental health conditions. She tirelessly supports me and my school's teams as we search to find the most productive and positive ways to reduce and eliminate the potential social isolation of students in our care. She truly recognizes that a child's sense of inclusion, belonging, and community becomes the foundation for healing and the formation of healthy, successful, long-term relationships. She advocates for student and caregiver voice and empowerment throughout this process, helping to strengthen and teach healthy and productive advocacy skills for these stakeholders, even amidst the most challenging of situations. Mrs. Hayes truly views every challenge as an opportunity for teaching new skills and focusing on positive change. Tanya, this truly sounds remarkable. Thank you so much for your work, and I'm so honored to present you with the Unsung Heroes Award today. Thank you so much, and I'm curious if you would like to say a few words.
Well, thank you. I haven't prepared anything, but I would say thank you so much, and thank you to Chris for the nomination. And I just appreciate the opportunity to have my awareness raised around your organization. And really, it just highlights for me the need for the collaboration between our mental health organizations and our educational organizations. And I thank you for this opportunity.
Thank you so much, Tanya. I appreciate this. Yeah, I always say collaboration. Get out of your silos. All over the lanes. The last
Thank
award
you.
will be presented by Simone Rushmeyer, so let me hand it over to her now.
Thank you so much. My name's Simone Rushmeyer. I'm Executive Director of Vermont Care Partners, and it's my absolute honor today to present the 2024 Mental Health Advocacy Day Lifetime Achievement Award to Julie Tessler. Over the past 27 years, Julie has worked tirelessly for Vermonters in her role as Executive Director of the Vermont Council of Developmental and Mental Health Services with Vermont Care Partners. Julie is one of the most caring and empathetic people I know. And it is through deep connections and fierce advocacy that she commits her daily life to ensuring people can thrive with dignity in their communities. With great appreciation for your endless dedication to Vermonters, Julie, and to our community-based system of care, which is absolutely essential, we present this award to you. I have it here. And we thank you so, so much.
Thank you. And,
I don't know if you want.
I really appreciate the recognition. And in accepting the award, I want to give my appreciation and give recognition to all the people who support the system of care. The best part of my journey and my career has been being part of this supportive community, having that sense of belonging. I'm really grateful to the self-advocates, the peers, the staff, my VCP colleagues, legislators, and state leaders with whom I've collaborated along the way. It's always been teamwork. And I've enjoyed that very much, but I've also learned very much, and that included today. So that learning journey has just continued, and I greatly appreciate that. And that each member of the community is supporting the health and well-being of others. You're helping people be seen and heard and valued. And I want to give a special shout out to the staff who do this work. You too deserve to be seen, heard, and valued. That was one reason I wanted the Unsung Heroes Award to be part of this today. You do deserve that, and I appreciate that you have not been fully valued with our pay, and that's one reason I really wanted to work to make sure that you get the compensation that you should be getting. I understand people are really making sacrifices in their lives and with their families to do this work. And it does give meaning and purpose to life. It certainly has given me meaning and purpose. And so I appreciate having had a role in that and supporting the work that you all do. It's been humbling, it's been an honor, and I could not have imagined a better career. So thanks, you appreciate it.
Thank you so much, Julie.
Oh, well deserved, Julie. I'm so glad our paths crossed.
Thank you.
So right now we are going to be heading into our lunch break where we will be sharing a PowerPoint, and we're going to get that all queued up for people. So please stay on your computer, and you can just wait until we start back up at 12:30, and we will be having our sharing of the stories. So thank you so much, everybody, and well-deserved, Julie, and all the award recipients. We really appreciate you and all the work that you've done. Thank you so much. Hello, everybody, and welcome back from lunch. I hope you had a great break and are enjoying Mental Health Advocacy Day this year. If you're in a watch party and you haven't posted your attendance numbers, please do so we can have an accurate number of everybody attending today. Our sharing of the stories is one of the highlights of the day, and I really enjoy this so much. People are here to speak their truth. Some stories may be emotionally difficult to hear, and we ask that you take care of yourself as you need to. In the chat are some resources if you do need them, and you could either call the support line 988, or we can have a support person chat with you. Over lunch, we queued up some of the presenters, and there are a few people who registered who are not here. So please feel free to raise your hand if you would like to share your story, and we can promote you as a panelist to include you in this session. So we ask that everybody keep their stories to about 5 minutes in order to allow everyone an opportunity to share their story. And now with that, I would like to call on some of our sharing of the story presenters. And I'd like to start with Autumn Lee Kenyon. So Autumn, if you could come on and just start your video and unmute yourself.
Also. Hi, my
Hi,
name is
Autumn. Thank
Hi.
you so much for being here today.
Thank you. Thanks for having me. Just give me a moment.
Absolutely. I probably took you off guard because you were expecting to come a little bit later.
I was. Just give me just a moment.
Okay. Now, I know that you were going to be sharing a poem with us that I heard you did such a great job with.
Yeah, it was something I had written actually as a journal entry.
Great.
So my name is Autumn Lee, and I'm a drug addict. Addict is my label. This label's been branded on me like a scarlet letter, forever stained, tainted. It makes me sad. I wish so much I could let it go, surrender, move on. I want to be known for who I really am. The woman who sits before you is so much more than an addict. So many traumas in my life I have battled through. Truly, I'm a victor of this life. The coping skills that aided my escape are only part of my story. They do not define me. I am slowly recovering day by day. I see transformation. I have to be strong. I struggle with the weight of guilt and pain I know all too well, but still I am so much more than my failures. In recovery, I am opening up, blooming, and releasing some of this hurt. I can share my scars because I know I'm not alone. I did think, though, however, I would finally be able to breathe through once my story was out. But sadly, I was mistaken. I first shared my pain, put down some of my weights, releasing some of my memoir to someone who I trusted, a confidant. I soon realized I had to be stronger than I ever thought possible. I had to feel the heavy weight of pain all over again, as I had to recapitulate my traumas over and over. To the police, to psychiatrists, to my family. I regretted revealing my wounds. I was seen by them as a predator. In the eyes of the law, I became a monster. Didn't matter I was young, just 12 years old. Didn't matter that I was sexually abused for years. The little me was just trying to understand, trying to reach out for guidance and how to get through the misery of suffering through all my ordeals. I carry this label heavy over 10 years now. I can't even describe the hurt and pain it's caused me, all because I wanted to have some support. My now recovery is what's finally saving my sanity. I wish I could go back to that scared little girl. She was betrayed by the ones closest to her and hold her so close. She's not a monster. She was just so broken and confused, trying to work through all the traumas that transformed her, the circumstances that stole her childhood and broke her trust in humanity. She was so strong and she didn't even know it. I'm now learning that holding gratitude and self-love will be my savior. I'm trying to carry that in everything I do and everyone I meet. I'm lucky to be alive. I used to not believe that. I can change my story. I can be a conqueror. I can learn to let my past subside. Time and lots of support are on my side. But I am determined. I have unwavering hope that I will survive. Thank you.
Thank you so much, Autumn Lee. You are a survivor. And congratulations on your recovery.
Thank you.
I know it's come a long way. And congratulations.
Thank you. Thanks for letting me share.
Absolutely. Next on our list is Brian. And Brian, if you could turn on your video, we'd love to have you share with us.
Hey, it works.
Hi, Brian.
How's it going?
Welcome. It's great. How about you?
Okay. A little nervous, but I think I can do this.
Oh, you'll do great. I'll turn it over to you.
Thank you. My name is Brian Plant II from Bristol, Vermont. While my mental health has been a lifelong struggle, the road back began in 2018. A simple routine visit with my doctor was an unintended first step. He asked a simple question, "How are you doing?" And apparently that was all I needed to break down uncontrollably sobbing, as I couldn't take it any longer. I had troubles and I needed a way out. I needed help. For many years, I had been sliding into a deep depression, fed by anxiety and insecurities, narrated by an unrelenting inner critic, always ready to remind me of all the worst things I believed about myself, to delight in the smallest mistake, and to ruin, diminish any reason I might have to celebrate. Why wouldn't I believe this messenger? The blows came directly in my own voice. I've always struggled with my weight. I've struggled with low everything. Self-esteem, self-worth, self-image, and a new one that I've been learning about, self-love. I've often struggled with social anxiety. When all you want to do is hide or blend in, it's extremely hard for someone of my size to do. Apparently, the discomfort wasn't great enough to encourage me to make necessary changes. It was just easier to start hiding away. I'm eternally grateful for friends and family that wouldn't let me. Unfortunately, that wasn't enough. The vicious loop began dragging me down. I would exaggerate even the smallest piece of negative feedback. Every time I'd be rejected in romantic attempts, became a harsh judgment on my value as a human. It eventually became easier to reject myself. I was unfulfilled at work, but the pay was good. I felt stuck. So I endured the frustration. As my weight went up, I shrank my world until there wasn't much left, and then I was laid off. Losing my job was hard. It hit me hard. I lost my sense of identity. Denying the shock of the system and the underlying depression began to hinder my efforts to find new work. It didn't take long before the fear of losing my home became a reality. I likely sold it before it was closed on, but I had to make the decision to move cross country back home to regroup. But in my head, it was as a failure, loser, and worthless. I was supposed to be stronger, better, tougher than this. I clearly was not. I half-heartedly tried to find work. I tried to find my way back, but all I was doing was spinning my wheels, sinking further into the muck. I bled my 401k dry so that I had something to live off, and I lived off the generosity of others for a few years. But these were only slowing the descent that ultimately landed me in a homeless shelter. I thought I was at the lowest point in my life. A reality shocked the system. Yet it took another year for what I could consider my true rock bottom. I struggled immensely between my mental health, my physical health, and now the difficulties navigating the complexities of the government social services programs. It was a slog fest. I felt under constant threat. I battled through way too many barriers, including my own biases and beliefs. I compounded it by making the decision to do this unmedicated. That's not a judgment on those that need the tool of medication. I just had always avoided facing how I truly felt about things for so long that to come back, I needed to break this habit. I needed to become open to trying new things, even if I thought they were too touchy-feely. What I was doing hadn't been working. Maybe someone else knew a better or different way. I'll probably continue to apologize to the folks at CSAC for my pushing back against all the soft languages that many three-letter systems seem to employ. I'd literally take the handouts and slides home to reread and then put in my own words to have a chance for it to land or resonate. Additionally, in making some good friends out of my peers, it has made all the difference. They listened when I needed to vent, which was often, and I learned I wasn't alone. Today, a few so very long years later, I'm in a better, more consistent, stable place. I've successfully come out of homelessness. My health still presents its challenges, but everything is trending in the right direction for a change. The light at the end of the tunnel is starting to look bright. I'm here today for many reasons. I think we need to share our stories of our successes and the stories of our pain. In spite of my anxiety, I found the strength to sit in front of legislators. In spite of my struggles, I try to find opportunities to volunteer. And while I don't consider myself an advocate, I am trying to find ways to get a seat at the table to maybe help others have an easier go of things. I found a way, and in my spare time, I've also found time to start learning the ukulele. I believe we all have something to offer. Don't forget it, even if it's hard to believe. Better days are ahead if one is brave enough to fight for them, even if the fight that day is getting out of bed. Seek out the support you need. If the people around you aren't helping, seek out those who will help you become your best self. You have to want it. It won't be easy, but it's worth it. For a long time, I believed I was trapped in the prison of my own making, in my mind with depression and anxiety. And while there's work to continue, I'm turning the tide. Depression and anxiety aren't going anywhere. I understand that it's very likely that they will be with me for the rest of my days. But now, they're trapped in my mind with me. I'm winning. My future looks more optimistic, brighter. I wish this for those involved today and those who couldn't be here. Don't give up. Thank you.
Thank you so much, Brian. Your words really resonated with showing how resilience can happen for people. And not only that, your advocacy. It is so wonderful to hear that you have been at the legislature and advocating for people. This is what we all need to do. We need our voices to be heard.
Thank you.
So thank you so much, Brian. Next on my list is Marla, and Marla, would love to have you join us. Hi.
Hey, Lori. Hi, everybody. Thanks so much for being here. Can you hear me?
Yes. Why don't you go right ahead?
It's really an honor to be here. I wanted to write my own poem, and I started, and my handwriting is so excruciatingly small that I couldn't even read it. I'm a fast typer, though, so I'm going to share a poem with you all called Journey, written by a world famous best-selling author who I'll share at the end of this the poem. And it's called Journey. So here you go. My journey has been long. I do not regret it. At times it has been dark, a perilous course. At other times, joyous, dappled with sunlight. It has been hard more often than easy. The road was fraught with dangers for me from the beginning. The forest thick, the mountains high, the darkness terrifying. And through it all, even in the mists, a small pinpoint of light, a tiny star to guide me. I have been both wise and foolish. I have been loved and betrayed and abandoned. And much to my despair, I have unwittingly wounded others and humbly begged their forgiveness. I have forgiven those who have hurt me, as I pray they will forgive me for allowing them to hurt me. I have loved much and given of my whole heart and soul, and even when badly wounded, have continued on the path with faith and hope and even blind belief toward love and freedom. The journey continues, easier than it had been. For those of you still lost in the darkness, May your traveling companions treat you well. May you find safe havens when you need them and clearings in the forest. May you find cool waters where you can safely drink, quench your thirst, and bathe your wounds. And may you one day find healing. When we meet, our hands will join and we will know each other. The light is there waiting for us. We must each, in our own way, journey until we find it. To reach it, we will need determination, strength, and courage, gratitude, and patience. And after all that, wisdom. And at journey's end, we will find ourselves, we will find peace, and the love that until now we have only dreamed of. May God speed you on your journey and protect you. And that lovely poem was written by a world famous author, Danielle Steele, not myself. But it's really such an honor to be here and a privilege to hear everybody, and God bless you all. So thank you.
Thank you so much, Marla. And when I started at NAMI Vermont, I first met you, and you've been a fierce advocate for many, many years. And there's lots of opportunities for people to be able to join these groups, like the Mental Health Block Grant, the program standing committees. Do you have any words about that to encourage people to join these groups?
I do. We are seeking new members for the Adult State Program Standing Committee, probably the Children's Standing Committee as well. The Mental Health Block Grant Planning Council needs members. We're looking for professionals, people with lived experience, and family members. Feel like I'm forgetting something. Help me out. But contact Lauren Welch at DMH, or you can contact me. I will, after done with this video, post my email in the chat.
Thank you so much. Many of the designated agencies do have advisory committees as well that they may be looking for people too. So these are just a number of ways people can advocate.
Yes, thank you. The Clara Martin Center needs members as well for our local program standing committee. So thank you.
Thank you, Marla.
Thank you.
I'd like to call Phoenix next. Hi,
Hello.
Phoenix. Thank you for being here today.
Of course, I'm glad to be here.
Great.
I'm speaking today, not in my normal professional capacity, but just kind of talk about my own experiences and what my path has been to where I am. The thing I want to sort of outline as my theme, my thesis statement, is the role of community and the importance of the role of community in building positive mental health. We've heard a lot about that today, and I think that my story is kind of it's a good prototype for that. So I am Phoenix, as I said. I work for a private mental health group, and I manage something called the Me Too Orchestra, which is a mental health-centric community orchestra located in Burlington, Boston, and Manchester, New Hampshire. I am also a person who's battled my own mental health problems over the years, like many of us who work in the industry, right? I grew up like many of us did, managing the ups and downs of a rural working class American lifestyle. As a child, I was called, correctly, sensitive. My parents noted that in the winter he doesn't do well, right? As a teenager, I quietly battled depression, internalization problems, and totally alone, while my twin brother publicly battled himself and his community and addiction and bipolar disorder. College was when things really came to a head. While I achieved in school and was successful socially, I was spiraling. And during a particularly tough night, I used that euphemism to describe staring down the endless chasm, as many of us do, I ended up hospitalized at UVM Psychiatry. And I struggled really hard with the process of finding what medications work, what therapy modality or therapist was right for me, and most importantly, how do I build a community that's protective of my mental health while I'm still so unhealthy myself? I entered a flyer for an orchestra several months later. You can see where this is going. I found others with mental health diagnoses and those that support them in an intentional group, all working together to make art all working together to be there for each other. By showing up every week, by practicing every day, I had a structure that I used to practice my burgeoning executive functioning skills, and I also had a place to go where I could expect to be loved and respected regardless of my wellness. And let it be said that my wellness was not well. This group of 50 people did not have to accept me as I was. I was sometimes rude, often unkempt, frequently disruptive, and there they were with open arms. I spent many years in this organization through school, graduate school, starting my first jobs in the mental health field. I made and lost friends, entered and exited relationships, got a dog. My mental health was not always good. In fact, I sometimes required supervision or professional care. But I never lost hope, and I wasn't hospitalized again. So when my life shifted, there was always a group to look at during the week. I found other communities during this time as well. Burlington's a good place for that. Small population, a lot of people reaching out. And had I not had groups of people who were intentionally supporting each other, not for pay, just to show up, I don't think that my progress would be where it is today. I talk about this a lot, both on stage with the orchestra as part of our advocacy work, and in my day-to-day life. Sometimes people are surprised. They say how well you're doing and things are really great and this and that. And as we heard from our presenters earlier today, that doesn't really mean much if we're not also then there for each other. And so in whatever way that we can find this community, the community, that's the most important thing. The community ends up being the story. We here sharing our stories in this moment are a community of people. And that is how I was sick and got well, and why I continue to advocate in the way that I do.
Thank you so much, Phoenix. Peer support is so very important. And it's not just one thing that works for people in their recovery. It could be peer support. It could be therapy. It could be many different things that work. And we should all keep in mind that, you know, we need to build those welcoming and caring communities through the work that we do. Well, thank you so much. I'd like to call Ronnie up next. Hi, Ronnie.
Hello.
Welcome.
Thank you very much.
I'm going to turn
I
it
was
over to
looking
you.
at how does a sense of belonging and support for mental health, and how can the people in Montpelier be doing things to strengthen it? Well, I've lived in the Burlington area for 20 years now. And when I originally moved up here, it was for education for my now ex-partner and my 3 children. And we took in a foster daughter from the Spectrum system. We weren't really aware of what the Spectrum system was at that time. My foster daughter, Kim Pugh, told me at the time, she was 17 and she was kind of aging out of the system, that if she had been 5 years old, people would be, you know, eager to adopt her. And instead, she was 17 and she had mental health issues and she was aging out of the system and nobody was really interested in her anymore. And that really hit home to me because although my 3 children were from teenage pregnancies, they never once felt like they weren't wanted and supported. And so Kim eventually took her life at UPM Medical Center after treatment at Brattleboro. And it was because she felt like she wasn't able to get the services around here. And that took me into being known as mom around here. And I do peer support, but I'm not educated for it. I'm also a Pathways client, and Pathways sent me to Washington, D.C. to a homelessness and mental health conference in 2019. But I am the person that is called Mom. So I get late night phone calls when Pathways isn't open and Howard Center isn't open, and Tammy Buddha from the Howard Street team here in Burlington isn't around. And I take my experience of being a 50-year-old woman who's non-binary, and then I take on all the phone calls. Like right now, I have one of my kids has cancer and is also in a recovery rehab in New Hampshire. So we navigate the medical system together because I thought I was having an anxiety attack in City Hall Park here, and that anxiety attack happened to be a heart attack. And that heart attack turned into a DNR that wasn't respected because I was told that I was not in my right mind. And my sense of belonging was when I came back to my street family, they wanted me to have my double bypass surgery. When I had my double bypass surgery, I lost my best friend's son to suicide in jail. And I was there when his organs were donated so that his life continued on with other people. I've lost so many of my friends to overdose. You know, I want to be the one to bring their stories, as I have done. I've spoke their stories and my story live in Washington, D.C. I've spoken my stories in Montpelier. I've spoken my story in Red Door Church. I've spoken my story at UVM Medical Center. I want to speak not only my story, but my street family stories and bring it to the legislatures when they're making these decisions that the motel program is going so well when it isn't going so well. It doesn't give you an option that you have to travel out of county to get housing for a single night when you can't make that trip because your medical programs are all centered right here in Burlington in the Safe Harbor program, which is the only homeless program for medical care. I want to talk these over as a mother taking care of people here on the streets and with my own mental health conditions. I want to do the peer support education, but I knew in advance that this is not something that is going to get paid for financially, and how am I going to pay for it? I have these questions and I want to speak to the legislatures and ask them, did you think these things through before you signed on the dotted line? So these are the questions that I'm coming here with, and I just wanted to meet everybody and say hello.
Thank you so much, Ronnie. And I'm so glad you're there for all the people to be able to receive phone calls and be there for them. I'm sure that means a lot to everybody. And the hope is with the peer support certification is that peers will be hired by organizations to serve as peer support providers. And definitely there's going to be income tied to that. So we're very hopeful to be able to employ a whole nother workforce. Thank you so much for sharing. Next, I would like to call up Ernest. And Ernest, we'd like to hear from you and your story. Let's try one more time with the video. There you are. Are you driving? Are you in a good
Yes,
place?
are you able to hear me?
Yes.
Okay.
I just want to make sure you're going to be safe driving and talking.
Yeah,
okay.
I am safe as long as you're able to hear me.
Yes.
Thank you for having me today. And mental health touches all kinds of people, and including the people who feed us, our farmers and our farm workers. Many challenges working on the farms. A lot of it has to do with long hours, a lot of stress, a lot of isolation, not having the abilities to know where the services are or transportation to get the services. And that includes our farmers and our farm workers. And there's limited resources for mental health services if you are a farm worker or a farm worker. And we need to expand that and include our agricultural workforce. We need to acknowledge in our work, connect with Farm First, which works with both farmers and farm workers, and they're limited. And also UVM, Migrant Health and Bridges to Health, they need more resources and connections to their clients and resources regarding mental health. Because mental health affects many of us, and they're hard to reach. And it's very physical and mental demanding work, especially on the physical side. Myself personally suffered a headache ultimately led to epilepsy. I suffered for that epilepsy for several years, and it was very hard. Luckily, I had family and colleagues, and I also learned of other medicines that are sometimes dismissed and that can be useful. And because of those, and over time, and treatment, and God bless, I don't have that epilepsy. That epilepsy left me down a terrible road that even left me to suicide. And I'm lucky to be here today to share my story. So as you're thinking, stressful challenges during the frost and during the flooding. So please include farmers and farm workers in the work, in the great work that you do, and make sure you're well connected and aware of it. Thank you. That's all I have. Thank you.
Thank you so much, Ernest. And, we had a conversation a little while ago, and you were telling me about a program called Farm First. And they have a lot of resources for people as well. And, when we look at mental health, it's mental health for everyone, right? Whether you're a farmer, elderly, young, we all have mental health and we all need to take care of that. Is there anything you'd like to talk about Farm First? Oh, you're on mute right now.
Farm First store, they are a good resource, and their resources are very limited. They are a resource, and they do connect farmers and farm workers, but it's very limited, and they need more. And also they need more awareness, and they need, I think they need to be included in the conversations moving forward. But thank you. They are a great resource. Thank you.
Absolutely. And we would love to help partner with them, as well as that's a good call to action for the rest of the people that are listening today too. So thank you so much, Ernest. I'd like to bring Tara on next. Hi, welcome.
Hi, thank you. Can you hear me?
Yes.
Okay, perfect. So my name is Tara Miller, and I currently work at Lamoille County Mental Health Services. I'm the Psychiatric Rehabilitation and Recovery Services Director. So that's a fancy name for the person who directs the CRT and AOP case management programs, our Wellness Center, our Peer Cadre program, and some other adult services. And I've worked in many capacities in the mental health field for the past 22 years in places like Pennsylvania, New York, California, and Washington State. So I have never known an adult life without the presence of severe mental illness, but not professionally, personally. I am a person who lives with a form of schizophrenia known as schizoaffective disorder. I first started having symptoms as a junior in college at Penn State University when I was 19 years old. However, in the early 90s, no one would name it, and my family doctor certainly didn't diagnose it. Over the next 5 years, my mental health would sometimes slowly, sometimes more rapidly decline. And in 2000, I had my first hospitalization, the first of many. I am a person who struggled with hearing voices, experiencing troubling delusions and other disorganized symptoms of psychosis, along with a mood disorder similar to bipolar disorder. Although I don't know what adult life without mental health issues is like, I do know that I have gone from surviving to thriving with my disability. When I was 23, I was taking 23 pills a day. I had been hospitalized over a half of a dozen times, and my prognosis was grim. I was told by my treatment team that I would be on entitlements and SSDI for the rest of my life, that I should just find a psychiatrist and a therapist to take care of me, that I would never live independently, and that I should basically just retire from life at the ripe old age of 24. So that wasn't good enough for me, and I made it my mission to change the outcome that so many had predicted for me. I decided to work in mental health, and my goal was to get a master's degree in psychology. As soon as I had a few decent months of some semblance of recovery in my back pocket, I applied for jobs, went back to work, and 2 years later moved solo to California, where I worked and started grad school all on my own. I built a solid work history, and within a year of going back to work, was off all entitlements and was on my way to building a healthy life for myself. I did eventually earn that master's degree and went on to become a national certified peer specialist and a certified psychiatric rehabilitation practitioner. My story, while inspiring, is not unique. I am sure that you will hear many stories about others who have overcome amazing adversity to go on living a life worth living. There was so much power in our stories, and I hope that you all will recognize the value of community mental health, especially programs that highlight peer support, peer-run respite, housing initiatives, supported employment, and psychiatric rehabilitation. For us survivors, we have transformed our lives from broken to brilliant, from hopeless and full of despair to a life full of hope and possibility, and from dependent to radically resilient. If there's anything I know, it's that these programs work. Peer support works. Rather than spend costly dollars putting people in institutions and lengthy commitments, have people engage in programs where they can work with folks who have lived experience and are sharing the power of their stories. If there is anything I can share with you, it's that we are psychiatric survivors, and it's not the system that has brought us back from the brink. It's individuals who have said, I have been where you are, and there is light, there is a future, and there is hope. That said, I hope we can strengthen our system to include more peer support services that help enhance an individual's quality of life and have them go beyond just meeting basic needs and move from a place of mundaneness to the miraculous. Thank you for listening, and I encourage you to reach out to folks labeled as mentally ill. For in sharing our stories, it's the first step to breaking down the stigma that still exists on a very real basis in the day-to-day life of people like me. I have truly transformed from patient to person and from surviving to thriving. It hasn't always been easy, but there is indeed hope for everyone who has struggled or actively pursuing whatever recovery looks like to them. Thank you so much.
Wow, thank you so much, Tara. Boy, would I love to have you on our team for NAMI in her own voice. You're so inspiring, and to
I'd love to be there.
You really showed how peer support can work and the importance of peer respite as well. So thank you so much for everything you've shared with us. I really appreciate that. Judy, could you come on next?
Trying to turn my video on. Oh, There we go.
Here you are.
Hi.
It's great to see you.
Oh, good to see you. Thank you so much for all you're doing, Lori, and the staff for putting this together, and all of our sponsors and everyone that's participating today. I really appreciate it.
Absolutely. It's a collaboration of everybody. And I just want everybody to know this is a lot of planning, both at Vermont Care Partners as well as the Vermont Association of Mental Health and Addiction Recovery and Recovery Vermont, who are the planners, but the 52 co-sponsors as well. So thank you.
I really appreciate being able to talk today. I'm speaking as a family member and a community member. I work with a number of folks in the community, and so I have firsthand knowledge of a lot of the issues that are facing folks in Vermont. I want to tell the story about my daughter today and advocate for supported housing. And also a big shout out and thanks to HCRS, who literally saved her life. Our daughter became very ill in high school, and she multiple diagnoses, and it already had suffered from trauma from being adopted from Russia, and anxiety, OCD, and then in high school it went further, high degree of suicidality and different levels of bipolar diagnoses. She had a time in the retreat, and it was time for them to send her home. And we said, we do not know how we can possibly keep her safe. And this is what faces so many individuals, folks that we have in the motels, folks that are living with their senior family members. You know, how do we keep our families and our loved ones safe? Well, we were so gifted, so fortunate that she was able to become part of the fairly new Hilltop program that HCRS here in Southern Vermont has, a program for young folks that have new psychosis, mental illness, and it's for basically around 18 to 24 years of age. And so our daughter was accepted into this program, and they literally saved her life. This program involves education, how to be a community service person yourself, how to cook, how to take care of yourself. And she needed full supervision because she was very ill at the time, and it really would vary. It was kind of a roller coaster, and this literally, we don't know what we would do if it wasn't for this. And after this program, and so there were two facets to this: care for her future, helping her finish her education. Plus, it's a safe environment. She had 24/7 supervision in a housing environment. So she was able to go from this program to college and to go on. We've had, ups and downs. She's had challenges, but what they've taught her has given her the skills. She has a degree in psychology. She's now working on getting her master's. So she's going to be able to be a therapist and care for others. Part of the time when she was in school, she was a crisis intervention person at Brattleboro Memorial Hospital. She's, done education, done other different programs, and we're really looking forward to her in the next year or two finishing up her master's degree and be able to give back to others. And it's also what has the other gift of it literally has been for us to become part of NAMI. And NAMI has given us the skills and the compassion and the empathy and the understanding to work with her through there's been, as I say, there's been challenges, but it's on the road to success, and we're just really grateful. But what it has shown me is how critical supported housing is. Now, hers was a level above, but because of her and because of NAMI, I also work with folks in the community with mental health challenges. Two of those folks currently are in the motel supported housing system. But what's critical for folks with mental health challenges, for folks with trauma, is housing not just an apartment, not just a place to live, but supported housing where somebody can check in on them. Somebody makes sure they're okay. This pays for itself. The thousands and thousands it costs for emergency room visits, the thousands it costs us for people that wind up getting hospitalized. If you have to go to the retreat, the cost of that is just, it's so much more than if we could have somebody in housing, which I know it's really tough right now because a lot of the budget money that would go into building new houses is going into supporting the people in the motel housing right now. So it's really, really difficult. But so much of our money goes to paying for these emergency room visits, ambulance services, mental health hospitals. And if we could just budget money to get housing where it is supported, it will save us a fortune. And so that is one of the things I'm here to advocate for is supported housing. And I also want to just thank NAMI and our other supporters, our designated agencies in the state of Vermont. And we wouldn't have a daughter and our family without them. So thank you very much for listening to me today. Really appreciate it.
Thank you so much for bringing that up, Judy. And supported housing is so, so important, as well as having that continuum of care so that as people are being released from the hospital, what is that next step to help support somebody in the community so they maintain their wellness and aren't just sent back home, but, having those step downs is so important.
Yes, it really is. And it is a challenge right now for folks to get all those resources. It really is.
I know. And of course, the challenge with workforce and, I think we've got a lot to overcome. And, but your daughter is so lucky to have you.
Thank you. We're lucky to have her. And hopefully she's going to be able to, give more back to the community as time goes on.
Absolutely.
Yep. Thank you.
Thank you. We do have more time if other people would like to share their story. And even if you don't want to share your story, do you want to bring up an advocacy issue? I think one of the things that I wanted to talk about was, the federal legislation of 988, the Crisis Suicide Prevention Lifeline. 988 is that 3-digit number for someone to call. And that is available 24/7. And it's really to help divert people to the right resources. Instead of calling 911, call 988 if somebody is not in danger. 988 is really the first step. So we need someone to call. We also need someone to respond with mobile crisis teams. And the Department of Mental Health is working on that with hiring a director, with being able to start creating mobile crisis teams in the community. We need them to be 24/7 as well. And I know that that's another challenge that we need to overcome. So if we have somebody to respond, we also need somebody to help us with somewhere to go. We don't always want to go to the emergency room because that is not the most appropriate place. Having urgent care models, living room models, being able to have peer support as well as providers help in that respect. Moving in that direction is going to be able to help people maintain their wellness so that they can de-escalate, get the help that they need when they need it, and avoid hospitalization. So these are just some of the things that NAMI Vermont is advocating for. And I just wasn't sure. I think we might have some attendees. I see Catherine Parker is there who would like to join us. And could we promote Catherine? There we go.
Hi.
Hi, Catherine. What would you like to talk about today? So we can't hear you. I'm not sure what's going on, whether you're still muted or Okay, I think we might have lost her. We can try again in a few minutes, but please, I welcome anybody's comments who would like to jump.
Sorry, Zoom
There
did
you
some
are.
weird stuff for me. It got kicked me and brought me back in really quick.
Okay, go right ahead. We don't see you, but we can hear you.
Working on that right now. Like I said, Zoom did some funky stuff to me.
Hi.
So I am both going to share the organization that I work for and my story. So first off, I work for Vermont Psychiatric Survivors. I have been a peer advocate since April, so I'm very new to this whole thing. So please give me grace in that. But my story, I have a lot of history with mental health. I am a two-time suicide survivor in where I came very close to hurting myself and was luckily able to stop. The first time I almost jumped into a frozen pond. The second time I sought out a weapon that was left in a friend's car. And mental health and peer advocacy is so important. Even in my work, when I go and talk to people, a lot of the time I have peers say to me that I helped them feel a little bit more human again, to where they're in a unit, they're talking to just clinical care supporters and stuff of that nature, and it can be very scary. And I know personally, talking to only therapists and not seeing someone who can understand your mental health on a very basic level is scary. And I know a lot of therapists do have their own journeys now. But before I knew that, it always felt like they were high up. They were like this ethereal being that could do no wrong. And learning now that that's a very different view, being on the other side of peer advocacy and peer support. Sorry, I don't have something better prepared. But one thing I would also like to do is read a poem, because I find solace in writing. And I actually have a published poem in G magazine that I wrote while I was in college. And it's called Monsters. And yeah, as children, we are told there are no monsters, that they are only imaginary. They don't exist. So we take comfort in that and ignore the true monsters, the ones that will tear you apart without spilling blood. They will murder you, but leave you living. They will take you away, yet leave you in your home. There are monsters in this world, but they do not hide under the bed. They live in your head. And so that was a poem that I wrote in college, when my depression was getting to me very badly. And I felt very isolated and alone, which I am sure many people in college have felt. And I was able to get into a creative writing class and have that published. And it was such an amazing feeling to know that other people connected with that, felt that poem. And sometimes, if the moment is appropriate, I will share it to my peers. And a lot of people like it, and they relate to it, and they love the imagery, because it is very true that these mental health illnesses and afflictions will just tear you to shreds and bits, and sometimes you won't even know who you are anymore. And I found that to be the case after the first time of me almost committing suicide is I didn't know who I was anymore. And I had to rebuild that, and I had to relearn that on top of relearning what to do with myself after an abusive relationship. So, and I always encourage, I mean, this is something I do, you don't have to, but I like to say that I take a Carrie Fisher approach to my mental health, where I am not afraid to tell people about my mental health, because it's a very important thing to talk about and try to destigmatize and have people talk about everything that's going on in their life. Not every, what you feel comfortable sharing, obviously. And I think that helps destigmatize a lot of things, and it helps people feel heard. And again, sorry, I don't have something better prepared. Jumped in last minute, but I hope at least something I said got through.
Oh, it absolutely did, Kat. Thank you so much for being that role model and, showing people this is how you do it. And you've come a long way. Thank you so much.
Thank you. Yeah, I'm very happy to be here, and I'm very thankful to my friend who pulled me for here from being a healthcare provider, and I worked healthcare through the pandemic, which is detrimental enough to mental health.
Yeah. And, it's so important to be helping people that are in the hospital. NAMI Vermont has some support groups at the Vermont Psychiatric Care Hospital. Rutland Regional Medical Center wants us back there, and being able to provide that peer support and, that non-judgmental listening with people. That's what you need to start in your recovery.
Absolutely. And we try to go all over different facilities. I visit, well, hopefully soon to be 6 facilities myself. Currently, I'm just visiting 5, but we're working on gaining entry to a 6th facility where I will go in and just talk to people and try to help them the best I can.
That's great. And, I understand that a lot of the hospitals do want volunteers to help, whether it be for art or other skills that they might have to share with patients. So what a great way to give back.
Absolutely. Thank you for letting me share.
Thank you. I'd like to bring
Hi, Andrea. If you can go ahead and turn your camera on and share your story.
Okay,
Thank you.
I disappeared for a minute, then I came back.
I'm glad
Hi,
you're back.
everyone. Hi, everyone. My name is Andrea. I wanted to share today that I am a survivor. And what does that mean? To survive many things, I have come to survive through childhood trauma, loss of my mom, mental health challenges in school, but I beat them and kept thriving. I went to college, got a degree, battled addiction. Today I had 23 years without using drugs or alcohol, and living and thriving. Recovery is a journey, and I am a peer provider for NAMI and other places. It helps me to advocate for myself, and I enjoy advocating for others. I'm on the board, and I also am part of NAMI National, and I really enjoyed this piece about belonging, because all my life I felt like I didn't belong anywhere. And I kept longing and striving and trying to belong and wondering, well, where will I belong? How can I belong? What does it mean to belong? Do I need to belong to the synagogue? Do I need to belong to this or that? And in Judaism, there's this behaving, believing, and thriving. And I just really have been very resilient. I recently had to move out of the state of Vermont, not knowing anybody, to come closer to my doctors. And I keep thriving and keep striving and working to find new advocacy means here in Massachusetts and continue to help and advocate for Vermonters as well. Thank you for letting me share today.
Hi, Andrea. It's so good to see you. Thanks for coming on. I think we had a little technical difficulty in between your sharing your story and me getting to another place.
Oh, that's okay.
Yeah, but thank you so much. I really appreciate you. You've come a long way, and you know, you're just such an inspiration. Thanks for everything you do.
Thank you, Lori. Thank you.
So I want to thank all of our storytellers today and people who shared from their heart, spoke their truth, and you know, we really appreciate everything that you've shared. It really helps us to understand, you know, what's needed, what works, and where do we go from here. And peer support, supported housing options. There are just so many things that can really help people. And thank you so much. I'd like to invite back my two co-planning colleagues, Martina and Amy. Thanks so much for helping to plan Mental Health Advocacy Day with us and bringing all of our co-sponsors together. You know, just some closing remarks and things that I wanted to mention was on Wednesday, January 31st, we're going to be providing testimony to many of the different committees at the legislature. So we invite all of you to come who are able to on Wednesday. We also are going to be in the card room. So please come join us. And I hear that Kat's going to be making us some cookies as well. So we don't want to miss that. But thank you so much. And, you know, I'd like also some closing remarks from Martina and Amy.
Thank you so much, Lori. Wow, it was just so incredible. And I'm so grateful to have shared the last few hours with all of you. In closing, I think I just want to invite us to continue to amplify our collective voice for mental well-being. And may we spread not only awareness, but also empathy. May we co-create a world where our mental health is a shared priority. And yeah, thank you so much to all these change makers who we so desperately need, who all showed up today and shared time in this room together with each of us. I really commend you for your bravery and your vulnerability. As we heard, we deeply and desperately need to be more vulnerable. And I do believe that together we can build a future that is filled with dignity and with respect, with non-judgment, and so much love and care. Thank you so much and be well.
Thank you, Martina and Lori. I've been completely honored to be a part of this day and found myself overcome with emotions throughout the day and how much power was behind the wonderful words of everybody who was able to share, from our fierce advocates to seeing individuals being honored for their important work, I love the idea of the unsung hero because there are so many people that are in this work that work tremendously hard to support individuals to be healthy and well and live their best lives. And I love listening to the stories. We heard stories of pain and success, and I'm reminded of the power of stories and how vital it is to create spaces that allow people to feel vulnerable and able to share their truths. Stories help to build and strengthen relationships, and relationships are where change happens, as we heard and know, and where we build community and a sense of belonging. And we know that caring communities are a cornerstone to healing. So I just really want to thank everybody who was involved, who showed up, and Lori and Martina for all of the work planning this wonderful day. And I'm really excited for the rest of this week and to see folks in the State House. Find me. I want to see you. I want to talk to you in any way that I can help you navigate the day or the week, however you choose to participate. So thank you to everybody.
Yes. And we will be having a resolution read on Wednesday at the State House as well. So we hope to see all of you there. Please fill out our evaluation form. Once we end the meeting, that will pop up for you and shared in the chat as well. So thank you so much, everybody, for joining.